comprehensive responses. And of course, the members usually get an opportunity to ask supplementary questions, of course, that are aligned to the primary question. So this morning, the Cabinet Secretary for Labor and Social Protection will be responding to a question that has been posed by the Senator for Kisumu County, Professor Tom Ojienda. This regards workers in the various sugar companies. One of the questions the member for Kisumu County will be seeking answers to is regarding the rationale behind discharging workers in state-owned industries, particularly in strategic sectors such as sugar and textile industries, and how those decisions comply with Articles 41 and 43 of the Constitution, that is on fair labor practices and the right to social and economic security, respectively. Linked to that particular question, also the Senator for Kisumu County will be seeking responses from the Cabinet Secretary to confirm the number of workers affected by that particular restructuring that carried out in Kisumu County, especially in Chemelili, Muhoroni, and Miwani sugar companies, and also clarify whether they have received full severance benefits, pensions, and gratuities without undue delay. Under the same question, the member for Kisumu will also want to understand from the Ministry for Labor and Social Protection whether the ministry conducted socio-economic impact assessments before approving the release, and if so, table the reports and indicate the mitigation measures for affected households and host counties, and also what immediate programs the ministry has introduced to reskill, redeploy, or otherwise safeguard the livelihoods of the affected workers, and how the effectiveness of these programs is being monitored. These are some of the questions that the Cabinet Secretary for Labor and Social Protection, Dr. Alfred Mutua, who's already within the precincts of Parliament and is just waiting to be ushered into the Senate chambers once the House corrects, will be responding to. This is the primary question that the Cabinet Secretary has appeared before the Senate to respond to, but of course we understand there will be supplementary questions from the members of the Senate regarding the concerns around this particular matter that has been raised. The Cabinet Secretary for Health, Aden Duale, who's also expected to appear before the Senate this morning, also has a number of questions that were also forwarded to his ministry prior to this particular day. He will be coming to give comprehensive responses to these concerns. One of the questions is from the Senator for Kirinyaga County, Honorable James Murango. And this question regards public health facilities in Kirinyaga County. The member for Kirinyaga will be requesting from the Senate to be provided with a list of all public health facilities in Kirinyaga County that have been issued with title deeds, as well as those that have not. Also, why many public health facilities in the county still lack these title deeds, and also if there are any measures, including budgetary allocations, that the ministry has put in place to ensure that all public health facilities in Kirinyaga County are issued with title deeds. The nominated Senator, Honorable Tabitha Mutinda, also has questions for the Cabinet Secretary for Health. These are questions that regard the budget allocations for the Linda Mama program, and the Senator will be seeking to get answers to these questions, including current annual budget allocation and how the funds are distributed across counties and public health facilities, including a breakdown of allocations from financial year 2024-2025 to date under the Social Health Authority, commonly referred to as SHA, as well as the Social Health Insurance Fund, commonly referred to as SHIF. Also, if there are any benefit package of Linda Mama changed following its transition under SHIF, and if so, what the specific changes in coverage, benefit amounts for normal and cesarean deliveries, and eligibility criteria. The Senator will also be seeking to understand from the Cabinet Secretary what safeguards are in place to ensure that funds allocated to link for maternal and child health services and that indigent mothers, especially in rural and marginalized areas, receive full benefits without undue delays. If you're just joining us, is that the House is about to commence its sitting. However, there is a quorum hitch. This is a hitch that might risk the House being adjourned if the quorum is not raised, that is at the commencement of a sitting of the Senate. The Speaker has directed that the quorum bell be rung for 10 minutes. This is to also alert the members who may be within the precincts of Parliament and perhaps running late to get to the chambers to hasten their steps and get to the chambers, join their colleagues, and enable the House raise that much needed quorum, of course, for the House to commence that business. If that quorum is not raised as provided for in the House Standing Order number 40, at the lapse of the first 10-minute quorum bell and the second minute quorum bell, then the House might risk being adjourned until the next sitting. However, the senators this morning are expected or are scheduled to engage the Cabinet Secretaries, being a Wednesday morning. Let's hear from the Speaker whether the quorum has been raised or a further quorum bell will be rung.
Sergeant at Arms, kindly ring the bell for further 10 minutes.
Well, we have heard from the Speaker that the quorum is yet to be raised and that the quorum bell continue for further 10 minutes. This is the second round of the quorum bell as provided for in the House 40. If the House fails to raise that quorum, it will be adjourned until the next sitting. I have seen the Senator for Embu County, Honorable Mundigi, just indicating that perhaps could be one senator needed. As provided for in the House Standing Order, at least 15 senators should be seated and when the House or the prayer is said and the chair taken, if that quorum is not present, then the quorum bell will be on for the first 10-minute round. If it lapses without the quorum having been raised, then the second quorum bell will be on, and that is currently where we are now. At least 15 senators are expected to be inside the chambers. Just a few remaining for the House to attain that quorum and also for it to be able to commence its business. The business that is lined up for consideration this morning is engaging the Cabinet Secretaries, being a Wednesday morning where the Cabinet Secretaries appear before the Senate chambers to respond to concerns. These are questions that are normally forwarded to their ministries prior their appearance on Wednesday morning, just to be able to appear before the House and give comprehensive answers to the matters that were forwarded to them. These are issues that emanate perhaps from the counties, inter-county, national, regional, or even international level. And when the Cabinet Secretaries appear, then they give comprehensive answers to these matters that have been forwarded to their ministries. And also, senators get an opportunity to ask supplementary questions that are aligned to the primary question. This morning, as I had indicated earlier, is that 2 Cabinet Secretaries have been lined up to appear before the Senate chambers. The Cabinet Secretary for Labour and Social Protection, Dr. Alfred Mutua, is already within the precincts of Parliament, just awaiting to be ushered into the chamber, take his position, and take the stand to respond to the questions. So if that quorum is raised, then the business will continue. However, as provided for in the House Standing Orders, if that quorum is not raised, then the House might be adjourned. We believe that is not what the senators could be expecting to happen, because normally, or on many occasions, the senators have been up in arms when the cabinet secretaries do not show up when they are invited before the chamber. So this morning, if the cabinet secretaries are here, then it is expected that the senators will also be able to enable the House correct and for the House to commence its sitting, so that the cabinet secretaries who are already within the precincts are ushered in and transact the business that they have come to do in Parliament this morning. We shall continue to take a look at the questions that the senators have for the cabinet secretaries this morning. The delay now allow me to hand you over.
So let's settle down, and Clerk, can we proceed to call the first order?
Order number 1, administration of oath. Order number 2, communication from the chair. Order number 3, messages. Order number 4, petitions. Order number 5, papers. Order number 6, notices of motion. Order number 7, questions and statements.
Now, honorable senators, we start with question number 113 by the Honorable Senator for Kisumu County, Professor Tom Ojenda, who I'm informed he is not present today. However, he has delegated the asking of this question to Honorable Beatrice Akinyi, who will ask this question on behalf of the Senator for Kisumu County. Clerk, can you confirm that the CS Labour is in the House? Honorable CS for Labour, welcome to the Senate once again. You're before the Senate for purposes of responding to question number 113 by the Senator for Kisumu County. Honorable Beatrice Akinyi, you may proceed to ask that question on behalf of the Senator for Kisumu County.
Thank you, the Honorable Speaker. As granted by you and requested by Senator Ojenda, this is question number 113. To ask the Cabinet Secretary for Labor and Social Protection. Question 1, could the Cabinet Secretary explain the rationale behind discharging workers in state-owned industries, particularly in strategic sectors such as sugar and textile industries, and how these decisions comply with Articles 41 and 43 of the Constitution on fair labor practices and the right to social and economic security, respectively. Question 2, could the Cabinet Secretary confirm the number of workers affected by the restructuring carried out in Kisumu County, especially in Chemelil, Muhoroni, and Miwani sugar companies, and clarify whether they have received full severance benefits, pensions, and gratuities without undue delay? Question 3, did the ministry conduct socio-economic impact assessments before approving the releases? And if so, table the reports and indicate the mitigation measures for affected households and host counties. Question 4, what immediate program has the ministry introduced to reskill, redeploy, or otherwise safeguard the livelihoods of the affected workers, and how the effectiveness of these programs is being monitored? And lastly, Honorable Speaker, on this question, how does the government intend to reconcile fiscal reforms with its constitutional duty under Article 232 of the Constitution on transparency, accountability, and responsiveness to prevent economic dislocations in counties that rely on state-owned industries? Thank you, Honorable Speaker.
Now, Honorable CS, I note that your response is fairly long. Since the same has been circulated to all honorable senators, you may wish to paraphrase it so that we save on time. You may proceed to respond, Honorable CS.
Thank you. Good morning, Mr. Speaker, sir, and honorable members of the Senate. I have a very comprehensive reply, but I'll try to make it, condense it, because there's a lot of repetition in terms of the facts. Let me start by giving a background, because it is important, because it will enable members to understand where we are coming from and also answer many questions asked. Mr. Speaker, the government of Kenya, through the Kenya Sugar Board, the Ministry of Agriculture and Livestock Development, and the National Treasury and Economic Planning, initiated a leasing model for state-owned sugar factories as an alternative to full privatization. This strategic decision sought to revive the struggling sugar sector, which has long been central to Kenya's rural economy and food security. Mr. Speaker, under this model, Nzoia, Chemelil, Moroni, and Sony sugar companies were offered to private operators for lease. As you are aware, Mr. Speaker, they had ceased operating properly. The objective was to enhance operational efficiency, modernize production, and restore profitability to ensure long-standing, long-term sustainability of the industry. The government, this is very important, Mr. Speaker, the government, mindful of the human and social impact of the restructuring, acknowledged that the transition could lead to redundancies among workers. Demonstrating its commitment to fairness, social justice, and compassion, it engaged the Kenya Union Sugar Plantation Workers, which is the recognized representative of employees, and entered into a memorandum of understanding on the 7th of May 2025. The MOU, this MOU between the government and the workers, provided a humane and lawful framework for managing the transition, anchored on the principles of dignity of labor, fair compensation, and industrial harmony. It outlined procedures for the retention, separation, and compensation of workers, and the payment of all accrued benefits in accordance with the law. Let me repeat that. All accrued benefits in accordance with the law, the payment. Key provisions in the MOU include, 1, that the person coming in, the lessee, will retain the current workforce up to 12 months under existing terms. So they're not walking in and firing people. For a full year, they retain the workforce. Number 2, after 6 months, the lessee is to identify staff for permanent retention and issue them with fresh contracts. Because definitely in any organization, there are people who really will not be adding any value to maybe the new work style, or maybe they have been overtaken by events. Number 3, non-retained staff, and this is very important, Mr. Speaker, honorable members, non-retained staff to receive a fair and lawful exit package, including notice or payment in lieu, accrued leave, severance pay as per the collective bargaining agreement, and all salary and benefit arrears. The Ministry of Agriculture and Livestock undertook to settle all salary arrears, pension contribution, and statutory deductions up to the handover date. Payments to be made in a phased schedule up to June 2026, and these have been ongoing very well. Dispute resolution was also clearly provided for through the Transition Committee, where both the workers and also the government, and even resolved through the Ministry of Labour for conciliation. It is important to underscore that the Ministry of Labour was not party to the leasing process. You know, it's a government, not just the Ministry of Labour. Where we come in is to ensure that we safeguard workers' rights, ensuring that all actions comply with Section 40 of the Employment Act, existing CBAs, and the terms of the MOU. Mr. Speaker, let me proceed to question 1, now that I've provided a background for understanding. The question is what the rationale behind the process and whether it's covered by law. The ongoing restructuring process in state-owned industries is part of the comprehensive reform programs aimed at restoring efficiency, financial stability, and competitiveness among these corporations. Everybody knows in this country that the sugar industry had collapsed. Cartels had taken over. People had not been paid salaries for years. You know, farmers had cut down their sugar. So this is a government program to revamp the sector and provide economy and money to the pockets of the people of Kenya. The discharge of workers under this restructuring is guided by lawful redundancy procedures as outlined by Section 40 of the Employment Act. It provides safeguards to ensure fairness and transparency for effective workers. Now, part of the process that we have demanded at the Ministry of Labour as per the law is that, one, that the employer must notify the relevant union, its affected employees, and the Ministry of Labour of what they are doing. Has this been going on? Yes, in this case of MATIANG'I. Number 2, provide justification of the scope of the redundancy. Has this been done? Yes. Number 3, pay statutory and contractual entitlements, including notice pay, accrued leave, and severance pay. Same, ongoing. The Kenya Union of Sugar Plantations, the recognized representative of the employers, had initially gone to court before this process where the MOU was agreed upon. The Ministry of Labour and Social Protection has a role to ensure that the redundancy process complies with Article 41 of the Constitution, Section 40 of the Employment Act, and the CBA in force. Mr. Speaker, we have to understand that the ministry does not have the power to approve or reject redundancies, because when anything goes to the private sector or to even the government sector, it is the employer who makes the decision, as long as the employer adheres to the set law. In upholding Article 51 of the Constitution, the Ministry ensures fair labor practices are adhered to, and in addition, the Ministry ensures that Article 43 is upheld through ensuring that dues owed to employees declared redundant are paid in full. In other words, human rights and rights of workers are upheld. In essence, this process balances economic necessity with human dignity, ensuring no worker is left without lawful compensation. Question number 2, Mr. Speaker, sir. It's asking whether the restructuring carried out in Kisumu County, especially Chemili, Moroni, Mwani companies, and asking about the numbers and their payments. The total employees affected by the restructuring process carried out in Kisumu County is 1,743, broken down in following. 1, Moroni Sugar Company had 747 workers affected, with 312 being permanent and pensionable, 435 being term contract workers. Number 2, Chemilil Sugar Company had 903 workers affected, with 376 being permanent and pensionable, and 527 being long-term or term contract workers. Now, this is quite interesting. Mwani Sugar Company had 93 workers affected, but it should be noted that this was leased or rather sold to, but was not leased but rather sold to Crossley Holdings Limited in July 2025. The company requested all workers to apply for their positions afresh, but only 79 did so, and all the ones that applied were all absorbed. Nobody was fired. The ones who did not want to apply were given their dues and they retired. It is important to note that under the MOU, it was agreed that all employees would receive salary arrears, gratuities, and accrued leave, and salaries dues paid by the Ministry of Agriculture and the National Kenya Sugar Board in a structured and phased manner. The amounts paid, partial payments of salary arrears amounting to 1.8 billion, have already been made between May and August 2025. The balance, amounting to 3.8 billion, together with terminal bills and third-party deductions amounting to 50 billion, shall be paid in installments up to June 2026. The government is in process, and we don't have any dues that have not been paid as per the agreement. Question C, the third question, Mr. Speaker, sir. Whether we conducted any socio-economic impact assessment before approving the release, and if so, mitigation makers. The ministry did not approve or oversee the leasing process, and therefore did not undertake a socio-economic impact assessment. This was a baby of the National Treasury and the Ministry of Agriculture. Our job is to ensure that any process that is conducted after a decision has been made is in accordance with the Constitution and the law in terms of the rights of workers. The last question, the second last question. What immediate program has the ministry introduced to reskill, redeploy, or otherwise safeguard the livelihoods of the affected workers? In accordance with the MOU, and this was also part of the discussion, all workers will remain in employment for 12 months, where 80% will be absorbed, the 20% nearing retirement, opting out voluntary, will be released with full compensation. Once a final list of retained staff is established, the Ministry of Labour, through the Director of Industrial Training, will collaborate with stakeholders to design and implement reskilling, retraining, and redeployment programs. These will empower affected workers with new skills and enhance employability in related sectors. The last question, Mr. Speaker, sir, how we are going to reconcile fiscal reforms with the constitutional duty of the Constitution for transparency, accountability, and responsiveness to prevent economic dislocation in counties. It is important to note that all decisions that are made in terms of relocating or folding or changing these companies and agencies and parastatals are undertaken by Cabinet, whereby Cabinet is able to sit down and look at the impact of movement of these organizations. As you have noted, Mr. Speaker, sir, the government is not winding down and closing parastatals that have major impact in counties. Actually, what we're doing is reorganizing, merging them to make them stronger so that we can have a government that is able to afford to run itself. I conclude, I submit, Mr. Speaker.
Senator Betty Sakinyi, do you have any supplementary questions?
Honorable Speaker, having listened to the response from the CS, my supplementary question refers to the non-retained staff that at the end of the process are released back to their to the communities. What is the component of this full compensation you refer to? And is there a program that is designed specifically to very disparate? Honorable Speaker, thank you.
Honorable CS, you may proceed to respond.
Thank you, Madam.
Very disparate. Honorable Speaker, thank you.
Honorable CS, you may proceed to respond.
Thank you, Madam Senator. As much as possible, the ones who have not been retained have been the ones who are near the retirement age. But if there are others who do not fit and maybe cannot be held, because you cannot expect a company to just keep somebody and that person is not productive, because then you go back to the same cycle of failed organizations. They are being paid their full pension, they are being paid their salaries, they're actually being paid money to cover up for the amount of time they are supposed to have worked. So, you know, in lieu of their work time. So, for example, if you are released at the age of 40 and you are supposed to work up to the age of 15, you're compensated for the time that you have been let go. So it's basically you're being paid in advance for work that you will not do. So we had already factored that in part of the agreement to make sure that nobody is let out and then they wallow into poverty. So at times, it is unfortunate that some people will get out, get the golden handshake, marry a second and third wife, a fourth wife, buy a big car, or go on holiday, as happens all over the country, and so they squander the money very quickly. One of the processes that we have done is, in terms of reskilling, is allowing some of these people who are out there who would like to come back to NITA and the TVETs to get new skills and get back to work. But they were not set out with nothing. They were let out with enough money to be able to live comfortably. I submit.
Senator Boni.
Thank you, Mr. Speaker. Mr. Speaker, the minister knows that the cabinet sat and made a decision on privatization. However, this was varied to leasing. Minister, since you sit in cabinet, why did you take the initiative to carry out a socio-economic impact assessment? You have now visited our people, families running into millions of Kenyans with challenges that must be addressed by the government. Why didn't you take the initiative?
Senator for Nairobi City County.
Speaker, I used to hear this thing called all-of-government approach shouted from podiums. I'm surprised that the CS in his response is actually telling us that we directed the questions to the wrong ministry, that we should have looked for the CS for Treasury, who were involved directly. Because he sits in cabinet, I think he should supply some of the answers to the questions that we are raising. CS, you have a responsibility as a government to protect your people, to find employment for them. And those that you found in employment, to try and sustain them in employment for as long as possible, because they are breadwinners for their families. When you allow private entities, such as these lessees, to be the ones to exclusively determine who they need to continue working or not, you are abdicating your responsibility. How is it possible, CS, that the government has no role whatsoever in making those determinations in order to protect its own people? Thank you, Honorable Speaker.
Senator for Tana River County, the Honorable Mungatana.
Thank you, Mr. Speaker. Mr. Speaker, listening to the minister, he gave a figure of 1,743 people affected in these redundancies. And the senator who was asking this question was specific about Chemilil, Muhoroni, and Miwani sugar companies. Mr. Speaker, what this Senate wants to know is whether there was full compliance of Section 40 of the Employment Act. It appears to me that this minister was giving us big figures, 1 billion, whatnot, but he's not telling us whether there was full compliance. In fact, Mr. Speaker, he's saying that there might be future payments. So the first issue is whether there was actual full compliance. The people who are let to go, 1,000, those are a lot of people. How many were actually paid? And Mr. Speaker, just complementary to that, of this minister to get those people reabsorbed into employment. Mr. Speaker, we need to be proactive as a government. You can't let more than 1,000 people unemployed, and then you are not giving. Don't give us figures. Tell us whether you have actually settled those people, because it's there. I thank you, Mr. Speaker.
Senator for Taita Taveta County, Senator Maruma.
Yeah, thank you, Mr. Speaker. Mr. CS would want to know if the employees would be paid before they leave, and how much it would be, or they would be paid after. In fact, the CS should give us a list of how much each will get, because he has indicated that If you are 30 years and you're supposed to work maybe up to 60 years, then you'll be paid for the rest of the time that you're supposed to work. So how much will each person get as severance allowance? Number two, if they're not paid before they leave, we have an instance where medical workers were eased off in 2000. Up to now, they have not received their severance allowance. And some of them have died. Some of them are sickly now. They are quite old. An auntie of mine was working for Ministry of Health. Up to now, they have not been paid. So we want to know how much each would earn, when they would be paid, and in fact, they should enjoy their salaries before they are eased off, or and when they get their lump sum, that is the time when they can be let to go. Thank you, Mr. Speaker.
Senator for Nandi County, the Honorable Chiranke.
Thank you, Mr. Speaker, sir. I'm surprised by the response of the CS Mutua, because Chemelil is part of Nandi County. And from his response, Mr. Speaker, I need clarity. He indicates that only representatives of, Mr. Speaker, if you can indulge me, representatives of Kisumu, Migori, yet Nandi and Kericho, which is part of Chemelil, has not been captured. So can you clarify? And then, Mr. Speaker, we are coming to the tail end of leasing process. What is the fate of unpaid 15 billion and 3 billion consecutively that are supposed to be paid to workers? Are they left to the dogs, Mr. Speaker? Can you clarify on that? I yield.
Senator for Kitui County, the Honorable Ombo.
Thank you, Mr. Speaker. Mr. Speaker, very interesting responses. Interesting because, Mr. Speaker, in the words of the CS, the government clearly has just let workers be dealt with by private investors in determining who continues to work and who has got to go home. But, Speaker, most importantly, the question that I have for the CS, after a determination has been made of who is going to leave and who is going to be retained, whose responsibility will it be to pay the gratuities and the benefits and to ensure that those payments, Mr. Speaker, are paid in time? Because there is a gray area there. Who exactly is it that will ensure that these gratuities and the benefits are paid in time to the workers that will have to be let go? I thank you, Mr. Speaker.
Senator Mbugua.
Thank you, Mr. Speaker. I would want the Cabinet Secretary to tell this House the level of involvement of the Workers' Union in this engagement, and also the involvement of the respective county governments, because this is a matter which affects the people in those counties. Thank you, Speaker.
Honorable CS, you may now proceed to respond to those questions.
Thank you, Mr. Speaker, sir, and thank you, members, for those very good questions. It is important to note, going for the first question about non-retained staff and the question about their salaries and the community. Oh no, I answered that one. Sorry, Senator Boni Alwale is asking about the socio-economic study that was done. When the paper came to cabinet, yes, a study had already been done on the impact of the industry and revival. And the socio-economic study is not just an economic study of when Treasury presented and agriculture, of just the people who are hired and who maybe would lose their jobs or earn their jobs. It was a study of the general impact of the country and of the region. Because you're talking about a sector that was basically crippled. We're talking about reviving a sector, creating wealth, you know, so that majority of people, parents who had given up, farmers who had given up, could now go back to growing sugar and making money. It was going to even inject money into the national, kitty to assist in the development of the country. So yes, there's a lot of thinking that went into it. In how do we revive this? Will it just be business as usual, government pumping money and nothing happening, or do we need to, think out of the box to revive this one and make it a working system? And as you're aware, citizens and of the areas where they've been affected by where the changes are happening are very happy with the government, because at last, They used to think there was a light, at the end of the tunnel. It's no longer a light, it's a glowing sun, and they're able to reap benefits. There's a question that was asked by a senator from Nairobi about, yes, it's a whole of government approach, definitely. It's important to note this, because I've seen it being repeated severally. It's important to note that, and I think some members may have walked in just after I did my introduction, so they were not aware of this. It's not everyone who is being sent home. According to an agreement between the workers and the government, only 20% is the maximum number of people to be sent home. As I have indicated, even one of the companies that bought one of the factories did not send home anybody. They rehired everybody who wanted to be rehired 100%. So the agreement has been, you come in as an investor, you are only allowed to send home 20%, so that also you can also retain people and also have a chance to employ people who can be of valuable to your work. But then we also say that anybody who is not being retained, and even the ones who are working, continue working, will be paid by the government of Kenya all their redundancies that they have not been paid for many years. Some of them have not been paid for years. They are living on borrowed money. They will be paid all their monies. They will be paid all their dues. The ones who are going away will even be paid for work that they should have been doing, but now they'll not be doing because they've been sent out. So that brings me to the third question by Honorable Mungatana, talking about the 1,743 affected. These are the total number of people who are employed, but it's only 80% of them who will be affected, will be retained, and only 20% will be affected, if I have my figures right. Let me look at the statistics. Sorry, yeah. The ones of the Kisumu County, is 1,743, with a breakdown of the workers that have been there of all the three companies. But the point that we're making is this, is that all of the ones that are being sent home or not being retained, they are all being paid their dues, and they're all being paid in lieu of service as per their contracts. If you're permanent and pensionable, you're being paid for the time that you're supposed to work. If you retire, if you're sent home at the age of 30, you're pensionable, you're compensated for the 25 years that should have been working to your retirement. If you're on contract, up to the period of your contract. We have ensured that human rights and that workers' rights are followed. This takes me to, I don't have the figures of the number of people who are totally reabsorbed, but I can provide that to Senator Mungatana, with your permission, Senator Speaker. My very good friend, the Senator for Taveta County, asked about the ones who for a long time have not been paid and on leave and on and all this. The payments will be paid on a phased program. It's already been agreed between the workers' union and the government. And the people who are paying is the government of Kenya paying. The government of Kenya has committed, and I gave the figures here, that we have committed, we've already paid 1.8 billion shillings, and this year we are hoping to pay another 3.8 billion. So we are paying everything in installments up to 15 billion shillings. That is our commitment. And the 15 billion shillings will be able to cover up all the costs to pay off all these workers and ensure that they are comfortable. Thank you very much, my good friend Senator Chirangai, from the question about Chimilil. The answers I was giving were specific, but they apply to everything. They are specific to the three Kisumu, the counties, the three companies in Kisumu County. The Center for Kitui asked about these private investors coming in. And it's important to know that the government of Kenya has midwifed this process. And the union, the Kenya Union of Sugar Plantations, has been the one that has been speaking on behalf of the workers. And they were able to sit down and agree comprehensively that they are happy with the process, and they actually penned an MOU. And I can provide a copy of the MOU, Mr. Speaker, with your permission, so that members can be able to look at it. and find that this was an agreed position. I think I have answered any that has yet to be answered. It's because it's been answered. I think I have answered any that has yet to be answered. It's because it's been answered while answering the other questions. I submit, Mr. Speaker.
Yes, we will terminate that engagement at that point. We will, Honorable CS, you may leave at your own pleasure. We will now move to question number 098, 103, and 117. These three questions are directed to the CS in charge of health. Clerk, you may usher in the Minister, the CS in charge of health, please. Honorable CS, once again, welcome to the Senate. You are before the Senate for purposes of responding to three questions. That is question number 098 by the Senator for Kirinyaga County, question number 103 by the Senator, and question number 117 by the Senator for Kisumu County, the Honorable Professor Odinga'S. So welcome to the Senate. We will start with question number 103. Senator Tabitha Mutenda. Question by Senator Daniel Manzo, that is question 033. That question has since been deferred pursuant to a request by the said senator who is not present. So that will not be responded to today. Senator Tabitha, you may proceed to ask your question.
Thank you, Mr. Speaker. Allow me, Mr. Speaker, before I ask my question, just quickly, through our standing orders, that is Standing Order 51C5, to read, and it states, a CS, Cabinet Secretary, shall provide a physical or electronic copy of a response to a question at least 24 hours before appearing before the Senate. I would like really to request that the CS office, CS Health, the CS having been a member of this, not really of this House, but of Parliament, knowing very well that at least we need maximum time to be able to look at the responses so that we can be able to engage from that. So it will be kind to note that your team does deliver the response on time because it has been received this morning. Thank you, Mr. Speaker. As I proceed, my first question, Waziri, was what is the current annual budget?
Senator Tabitha.
Yes.
Are you saying that since the response has been received this morning, you're unable to interrogate that response effectively? Is that your position? Or despite it having been received this morning, you're still comfortable interrogating the response? If that is the case, then you may proceed to...
Thank you, Mr. Speaker. The response has been received this morning at exactly 9:30 as the chamber was starting. Luckily, I've been able to go through the responses, and I'm okay. We can be able to engage. My first question, Waziri, is what is the current annual budget?
allocation for Linda Mama program and how these funds have been distributed across the 47 counties and public health facilities, including a breakdown of allocations for financial year 2024-2025 to date under SHA, or the Service Health Insurance Fund, that is SHIF. Mr. Speaker, the second question: has the benefit package of Linda Mama changed following its transition under SHIF? And if so, what are the specific changes in coverage, benefit amounts for normal and cesarean deliveries, and eligibility criteria? Number 3, Mr. Speaker, what safeguards are in place to ensure that funds allocated to Linda Mama are used exclusively for maternal and child health services, and that indigent mothers, especially in rural and marginalized areas, receive full benefits without undue delay? And lastly, Mr. Speaker, what steps the ministry has taken to ensure access to Linda Mama services in under-resourced or understaffed health facilities, and how it is addressing barriers faced by mothers in remote and hard-to-reach areas under SHIF structure? Mr. Speaker, I submit my questions.
Honorable CS, you may now proceed to respond.
Thank you, Mr. Speaker and honorable senators. Let me, Mr. Speaker, first apologize, and I think it's on my side that going forward I will comply with the standing orders and provide the answers, not even 24 hours, but 48 hours. These I even had to raise with my staff this morning, and it's an oversight. It will never happen again. Honorable Speaker, on the first question on why, what is the current annual budget, question 1, which the senator has said, my answer is this. The Linda Mama program is not currently administered under the Social Health Authority infrastructure. While the program was instrumental in expanding access to free maternal care, it is important that it faced very critical challenges that necessitated a shift to a more comprehensive and sustainable model. And these were all anchored in the 4 laws that were passed by this House. These challenges, Mr. Speaker, included frequent financing constraints, budget cuts, delay reimbursements, significant access and equity gaps, especially for adolescent mothers without identification, and a benefit package that was not comprehensive because it was excluding critical maternal and newborn services like complications and the NICU care. And in response, Mr. Speaker and honorable senators, the Ministry of Health, through the Social Health Authority, has adopted a very comprehensive household coverage model to ensure all vulnerable families can access a broader range of essential health services. And that's why, as part of this strategic framework, the national government, through SHA and the Ministry of Health, is sponsoring 558,000 indigent households, which were identified through the State Department for Social Protection Enhanced Single Registry in order to access healthcare under SHA. And this is ongoing. Governors have come in, members of parliament, and many other philanthropists are coming in to support this program. Furthermore, recognizing teenage pregnancy as a very critical public health challenge in our country, the Social Health Authority has also introduced a very deliberate, targeted intervention for adolescent mothers and their newborns, leveraging digital health platforms and using our community health promoters. SHA now can facilitate real-time registration of these vulnerable groups, ensuring equitable access to subsidized care. And I'm happy to report that to date, 22,000, since SHA came into being, 22,000 teenage mothers across our country have accessed maternal services free of charge. The allocation of funds now operates on a fee-for-service model where funds follow the patient via claims, and this has replaced the previous fixed pre-allocation sort of budget. Question B was on the benefit package of Linda Mama. Honorable Speaker and members, the transition under SHIF has significantly expanded the former Linda Mama benefit package from a very narrow maternal focus to a very comprehensive household coverage model, now known as Linda Jamii scheme. While delivery services remain very central, reimbursement has improved through a fee-for-service model, and which is aligned with the actual service cost, and this has given us and strengthened inclusivity for all vulnerable households across our country. And the table, Honorable Speaker, that I have provided shows the scope of coverage under Linda Mama and under the new SHIF-SHA program. I really don't want to go. It shows the reimbursement model, the eligibility, the scope of coverage, and if I pick on, for example, the scope of coverage, under the, before Linda Mama, this was limited to maternal health, ANC, formal, and C-section delivery at our primary network centers. But under SHIF and SHA, comprehensive household coverage, which include outpatient, inpatient, emergency and surgical care, chronic disease management, maternal and newborn care, including all the complications, is now covered under the Linda Jamii. If you look at the reimbursement model, Honorable Speaker and members, under the Linda Mama, there was a predetermined fixed rate paid by NHIF. There was, the fee for normal delivery was 2,500 for level 2 and 3, and 3,500 for private and faith-based level 2 and 3, and 5,000 for public facilities, and 6,000 for faith-based facilities and private level at level 5 and 6. C-section was Kenya shilling 17. But if you look at the fee-for-service model under SHA, SHIF, the facilities reimbursement is based on the actual service rendered at the approved tariff rate and passed by the House. And then there's standardization of the reimbursement. Now, both faith-based, private, and public, women can have delivery, and SHA will reimburse 10,000. For cesarean section, 30,000 because of equity, whether they go to public hospitals, whether they go to private hospitals, whether they go to faith-based hospital. And then eligibility is different. Under the Linda Mama, eligibility was only targeting pregnant, but adolescents and undocumented mothers were often excluded. But now if you look at the Linda Jamii or the SHA-SHIF under this transition, indigent households are identified via a very proxy mean testing as per the law, as per Section 27 of the Social Health Insurance Act of 2023. So pregnant, adolescents, and newborns are all included through a very targeted intervention using a temporary ID, and the entire household is covered under the SHIF comprehensive. So where the teenage mother can either use her birth certificate. She can use her parent identification. And the system has created a special ID to identify those important section of our mothers who are the teenage mothers. Question 3 about the safeguards. Honorable Speaker and members, several safeguards have been initiated to ensure that the funds are allocated for maternal and child health services and that vulnerable mothers receive full benefits without undue delays. And what have we done? We have done, number one, we have introduced legal and policy safeguards. The Social Health Insurance Act of 2023, which this House has passed, mandates proxy means testing to ensure that only eligible vulnerable groups are covered, and this is anchored in the use of the funds within Section 27. 2, and more important, digitization and transparency. Reimbursement are processed through digital platforms that validate service for payment. They minimize fraudulent claims. Real-time registration is done through digital health platforms. Our community health promoters help us to instantly enroll to ensure timely access, especially in the most remote part of our country. Then there's equity and beneficiary safeguards. SHA has given priority to the most vulnerable households to ensure that the once registered indigent beneficiaries are entitled to maternal services free at the point of use, without facilities prohibiting from levying additional fees for covered services. And finally, I think the other question was, what has the ministry taken to ensure that access to Linda Mama services in the under-resourced, understaffed health facilities, and how it's addressing those barriers which are faced by our mothers. Honorable Speaker and members, to ensure access to maternal service in under-resourced and hard-to-reach areas, the Ministry of Health, through the Social Health Authority, has implemented the following measures. Number one, digital registration deployment. SHA has deployed real-time digital registration platforms at all of our over 10,000 contracted health facilities countrywide, both public, private, and faith-based. And this allows pregnant women, including those in remote areas, to be enrolled instantly and granted immediate access to services without the administrative or financial delay. The second one is the community linkage through the community health promoters, who have been empowered to identify, to register, and to link pregnant women, particularly the adolescents and the vulnerable households, to the nearest accredited facility. This strengthens the last mile access, and it will ensure inclusion of mothers to hard-to-reach areas. Lastly, Honorable Speaker and members, we are targeting the under-resourced facilities. And how do we do this? The increased and the standardized fee for service tariff for maternal services is designed in order to create insensitize both for the private and the faith-based facilities in rural areas to remain contracted and sustain quality maternal care. And that's why I am very specific that in some of our most remote rural parts, the faith-based health facilities are available, and that's why we don't want to discriminate. Our mothers can go to either faith-based facility, they can go to private, if the public facilities are not available in that area. And then the last one is to provide evidence of the outcome achieved through the Linda Mama program since inception. Honorable Speaker and members, investing in maternal and child health is a proven strategy for improving the outcomes data from the Kenya Demographic and Health Survey, which demonstrates progress, and it attributes in part to increased access facilitated by the preceding program. And reduce maternal mortality. The maternal mortality rate declined from 362 deaths per 100,000 live births in 2014 to 355 deaths per 100,000 live births in 2019. Mr. Speaker, I am very ashamed to say that figure. There are many, many mothers. Kenya should not be at 355 per 100,000, 355 mothers die for every 100,000. Our peers, our regional neighbors are doing better. But the biggest problem I have for now is that even the data is old, is the data of 2014. Now, what we have done at the Ministry of Health, we have decided to do our own in-house data. And we must ask this House and the whole country that it should not be business anymore, that we can talk of maternal mortality rate of this figure. Mothers, when they walk to facilities, they are not patients. When they walk to facilities, they walk to facilities to go and give life. It is immoral, it's unconstitutional, and I think it is not acceptable for us to have this kind of high maternal and child death in our country. And I think at the highest level, from the presidency to the ministry, to the houses of parliament, to the leadership, all of us stakeholders together, we must discuss this openly. And what we are also trying to do now, that we have digitized our healthcare system. In another 3 months, we will make it mandatory that every health facility in our country, be it private, public, faith-based, they must report maternal deaths. And child deaths on a daily basis through a dashboard. Lower the... But I think going forward, as a ministry, we have a moral duty to do our own in-house every year, every 2 years, both every year, every 2 years, both for the infant mortality and for the maternal mortality rate. Of course, there is improved service utilization. The percentage of women attending at least 4 antenatal care visits in our country has increased from 52% in 2014 to 60% in 2019, indicating improved access. But when I walk around counties to do the SHA rollout, a number of leaders are not agreeing with this figure, and I agree with them, because the data is old. The data is maybe 5 years, 6 years, 7 years. So we need to find out the correct data. And I am ready, willing, Mr. Speaker, I have set up a committee led by the Director of Medical Services, Dr. Amoth, to make sure that we get the right data. How many of our mothers die? We want to make it a mandatory that every health facility reports maternal and child deaths in our country. That is the questions for Honorable Senator Mutinda. Thank you.
Senator Mutinda, do you have any supplementary questions?
Mr. Speaker. Bwana Waziri, thank you for your responses. And I want to agree with you that there is no single mother who becomes pregnant and wishes to die or even lose their child. I'm happy that you also note that. Now, I sit in the Committee of Health, and yes, Mr. Speaker, through you, we've really been visiting different counties, and recently we were actually in the Eastern region, and I want to agree that yes, when we ask the question of if SHA is working, the response is that SHA is working. I want to narrow my follow-up questions, Bwana Waziri, to part C. When I asked about the issue of the funds, your response specifies and says that Chief Act 2023, Section 27, has taken care of that. But when I look at Section 27, Bwana Waziri, it is much more on the contribution of Chief. I would want to know, Bwana Waziri, of the measures that have been put in place, that there is a follow-up from SHA that ensures, you've explained that Linda Mama is not in place, but it has been substituted. What is SHA doing to ensure that there is a follow-up of these funds specifically for Linda Mama? At the same time, the issues of capacity building, Mr. Speaker. Waziri, you've talked about digitalization and transparency. I have noticed, yes, your team is on the ground doing the digital registration, especially to these young teenagers under 18 who have no national ID. Putting in place to ensure that even the young mothers who are not aware that they can actually get these services, they can know that these services are, that there is that capacity.
Yes, Senator Mutinda, avoid speeches. Go straight to the question, please.
Okay, Mr. Speaker. I know the young mothers we've met in hospitals, they have no even phone, they have no documentation. What has been put in place to ensure that even those ones with nothing are being assisted with the shortest time, because sometimes they always explain to us that they have just been kept in hospital, just waiting, to hope that things will be sorted within the shortest time possible. Lastly, Mr. Speaker, is mechanisms to monitor transparency and accountability of SHA funds from Linda Mama when they are remitted to the health facilities, and how SHA is looking forward to sort the challenge that is being experienced by most of the health facilities, whereby there is delayed reimbursement of the SHA fund to the health facilities. Hence, they are not able to continuously sustain offering the best services that they're supposed to offer.
Honorable
Thank you, Mr.
CS,
Speaker.
you may proceed to respond.
Honorable Speaker and the members, the current Linda Jamii budget is 900 million. And this budget is supposed to cover 400,000 teenage mothers across our 47 counties. And every year, the estimates, different counties, the estimate is about, we have in our country about 400,000 teenage mothers. And they are the ones who are to be covered by this budget. So far, from our record at SHA, through digitization, we have covered 22,000, paid for and went home. The question is, how do we trace them? How do we get them? We have the numbers. We have counties with the highest numbers I can give. We have counties with the lowest numbers. County like Kakamega, Kilifi, the highest numbers. What are we doing to make sure we mobilize? We are talking to governors, we are talking to leaders, both political, church leaders, and we are mobilizing a very robust registration of teenage mothers and going with all our county governments. Everywhere we go, we give them the numbers, and we tell them These are the numbers of teenage mothers who exist in this county. These are the numbers who have visited health facilities and who have accessed this free service. Please help us mobilize. We are using our community health promoters, and we are even urging the House and the leaders to make sure that all of us together, we are not promoting it, but we have no choice. They are our children, and we must protect them. So, including the leadership here, we really want to make sure that we increase our number from the 22,000 teenage mothers who have already accessed and cover all the 400. To date, Honorable Speaker and members, we have 476,553 deliveries, normal deliveries. And we have another 150,602 who went through cesarean delivery. Our community health promoters are well-trained, particularly in terms of registration of teenage mothers. And so far, the claim that SHA has paid, particularly on maternity, is about 9.7 billion to all health facilities at all levels in all the three categories of private, public, and faith-based. So if you look at what this House has passed, the Facility Improvement Fund Act, which ring-fenced funds at the facility for the improvement of those services. And these funds, to the good wisdom of this House, you have decided that the reimbursements must go direct to the facility, not to the county treasury fund, so that the facility can buy drugs, the facility can even hire healthcare workers, either on contract or locum. And all this is geared to make sure that the health facilities are managed better through the reimbursed funds in order for us to achieve key health indicators and priorities, Mr. Speaker. Thank you, sir.
Senator Mandago.
Thank you very much. My supplementary question to the CS is on the issues of reimbursement and clearance of mothers to leave the facility. Apparently, there is inordinate delay in hospitals, so that the mother can take another 3 days, and the facility says SHA doesn't cover the 3 extra days you've stayed in the facility, and that is what is bringing the trouble of detention of mothers in facilities. I'm specifically speaking of Moi Teaching and Referral Hospital, where cases have been reported to me as the area senator. Apparently also I'm the chair of the senatorial committee, so I cannot escape the response. Since you are here, I think it is a good opportunity to respond to that, so that all other facilities in the country can be able to facilitate matters as soon as they are due for release from facilities. They are immediately released, regardless of the processes that the hospitals have to continue with billing and so forth, so that mothers, again, SHA doesn't pay for them, but they have stayed another 3 days and they are forced to pay, and in the process they actually pay more than SHA, what SHA is paying for them. Thank you very much, Speaker.
Senator Mazayo.
Asante mstahiki Spika. Mstahiki Spika, swali langu kwa waziri wa afya ni kwamba kulikuwa na masikizano ama mkataba hapo awali ya kwamba wagonjwa watakaokuwa wanajiwasilisha katika hospitali za kiwango cha kwanza, cha pili na cha tatu, yaani level 1, level 2 na level 3. Hawa wagonjwa hawa ama kina mama wanaokwenda katika zile hospitali ilikuwa watapata matibabu ya bure, ya kwamba wakiingia pale watapewa matibabu na alafu wataenda zao nyumbani bila kulipa chochote, wakati wakiwa wao ni wasajili katika yale mamlaka ya afya ya jamii ambao ni SHA. Sasa nauliza, ni kwa sababu gani Bwana Waziri, katika ule mkataba ambao ulikuweko baina ya mamlaka ya afya ya jamii ambao ni SHA na vile ambavyo ulipeana mkataba huo, ya kwamba watu wakija, wakina mama, watoto, watu wazima wakienda, ikiwa wao ni members wa ile SHA, wasiweze kulipa, lakini hivi sasa tunaona ya kwamba katika mahospitali yetu wanalipa. Je, iko uwezekano wa kwamba wewe unaweza kuregesha tena hiyo amri, na wao wamejisajili na SHA wasiweze kulipa malipo hayo, ili turudi pale pale tulikuwa zamani, ya kwamba wakipata matibabu wanaondoka, watapata matibabu bure, alafu waende zao nyumbani? Asante Bwana Speaker.
Senator Aaron Cheriot. Now, honorable senators will know that question number 116, which is the next question after this, essentially deals with matters surrounding SHA. So you may want to hold on some questions and ask them when we are dealing with that particular question.
Mr. Speaker, if that is a guidance, then I follow your guidance.
Thank you. Thank you. Senator Shakila.
Thank you, Mr. Speaker. Mr. Speaker, my question is regarding SHA. We know since SHA took over, it has been facing a lot of challenges.
Senator Shakila, I
Yes.
have just said that we will be moving to interrogate matters SHA.
So I'll do that. I thought you
you'll
gave
get
me
an
the-
opportunity at that time.
Okay.
Senator Boni.
Thank you, Mr. Speaker. This issue is a matter of life and death, and the minister has a very good opportunity to speak to Kenyans about this. Minister, a living patient by the name of Sheila Litunya Omungala from Kakamega, Butere, working in Nairobi. She went to deliver. She had paid for SHA. She's a small mamamboga in this town and what have you. She had done her part. But at the end of the process, she was faced with a bill of 51,000, of which thankfully SHA paid around 400,000. The remaining 200,000, they told her, you must pay. Minister, this is the elephant in the room. When a poor woman like that who had played her role, she had paid. She then has to pay 200,000. Then they can't say SHA is working, because these are the same women. When she was delivering her first and second child under Linda Mama, she just went, delivered, and went back home. But in your case, she's being challenged, despite being a member, you must pay. I want to thank the Senator of Nairobi, because I had to use his office to get to social workers for me to get that bill to be waived. Not many patients have access to us leaders.
What is your
question,
question,
my question.
Senator Boni?
Yeah, I had to pay it because I feel a lot of pain about Litunya.
I share your pain, but go straight to the question, Senator.
So, Minister, the question you must answer for Kenyans, this extra bill, which SHA expect people to pay, why don't you accept that it is a statement of a failed system of funding, and therefore you rework it so that patients, my dear brother, can enjoy in the same manner they were enjoying under Linda Mama. When you convert Linda Mama into Linda Jamii, that is fraud, because in Jamii, people, and Dr. Moth is there, some of the people in the Jamii have got backache, you know, some weird things, but delivery of mothers is a serious emergency which is life-threatening. You've just told us about the 355 women who die out of 100,000 people. That should not happen. Governor MATIANG'I has shown you the way in Kiambu. He has sustained 8 months without a single maternal death. It's doable. And because my younger colleague is there.
Senator Beatrice Akinyi.
Thank you, the Honorable Speaker. Welcome, CS Duale, to the Senate. And from the onset, I want to say that Linda Mama was one of the best things that happened in this country. My question is, Honorable Speaker, CS, are there health facilities in this republic holding mothers that have delivered for non-payment of bills? And what is the policy of the ministry? Because the ministry is the custodian of the sector's policy. It is sad that there are children who have to spend their first days in hospital because their mothers or their parents or their guardians cannot pay bills. Thank you.
Senator Nabuire.
Thank you, Mr. Speaker, for the opportunity to contribute towards supplementary questions to the CS. One, I would like to ask the CS that anti-D for ESA's negative was a part of the Linda Mama package, but it was scrapped off. So currently, most mothers with this condition are not getting it because of the cost. Secondly, I would like to inform that sometimes patients are not...
Senator Nabuire, you are entitled to just one supplementary question, which you've already asked. Kindly take your seat. Senator Hamida.
Thank you, Mr. Speaker. Bwana Waziri, looking at Linda Mama, unfortunately, you know, free things also at times, you know, they come with a price. We have going to, when we inspect hospitals, we have found shortages of staff, high workload, inadequate equipment, inadequate beds, delivery theaters are not there. And seriously, it's such a pain to see that, imagine, you know, you have a maternity without theaters. So I'm just wondering, is there any awareness? And also looking at our awareness on women, especially the young mothers, that at times the marginalized groups need to know about the right of the Linda Mama and what's covered and how and the access to Linda Mama. One last thing is that the tracking and accountability, Bwana Waziri, how do you monitor for empowerment working? How do we link that monitoring of these programs to outcomes, you know, looking at maternal mortality? Bwana Waziri, I had a motion here in Parliament on postpartum depression, mothers on mental health. And I think my motion went through, and so I think the hospitals need to have a wing for postpartum depression, Bwana Waziri. What we found it very fun is that we've gone to many hospitals, found mothers who have given birth, and they're...
Senator Hamida.
Yes.
You have asked...
Many
questions. Kindly yield. Senator Chirange.
Thank you, Mr. Speaker. Mine is Waziri Duale. Welcome and thank you. You are doing a good job. My question will be very simple, Waziri. This transition from Linda Mama to Linda Jamii, did we at any point lose the package of Linda Linda Mama as you transit to Linda Jamii? Can you give us the package so that you debunk the street political fraud by Senator Kalwale, so that Kenyans, this is the only forum. We don't want Senator Kalwale to go to Malinya and mislead people that shifting from Linda Mama to Linda Jamii is a fraud. You have the opportunity to shine, Waziri. I yield.
Senator Meth.
Thank you very much, Mr. Speaker. Sir, mine is actually related to what Senator Akinyi asked. And I saw the maternal deaths report, and Nyandarua had the least maternal deaths report in the entire Republic. But my question was, Waziri, since most of these facilities that we have are run by county governments, my question is, in terms of detaining mothers and their newborns, is there a policy in the ministry of as to how long a mother can be detained in a hospital because they're not able to meet their bill?
Senator Mungatana.
Mr. Speaker, thank you, and thank you, Waziri, for the good job you're doing at the ministry. Mr. Speaker, we pay 2.75% of gross with a minimum of 300 shillings, or means testing is done, and we pay 2.75%. Now, this is what Kenyans are paying. The question I wanted to ask you, Mr. Speaker, through the minister, through Mr. Speaker, is that in this country, we have many other African nationalities who are living here. And maybe part of that report of deaths includes the nationalities who are living in this country from other African nations. I represent this Senate in the Pan-African Parliament. And the question is, are people covered, those who are not paying, like those who are not paying SHA now, are they covered in this Linda Jamii? What do we do with them? How do you take care of the Congolese, the Zambians, the Ethiopians, and everyone who is living here? Your system of registration says *.147#, and if you go down, the next is your ID number. These people don't have ID numbers. What do we do with them? They are with us here. They are still going to give you those maternal deaths. What do we do with them? What is the stand of the Kenya government on this matter? Thank you, Mr. Speaker.
Senator Nyutu.
Thank you, Mr. Speaker, for the opportunity. And allow me to just remind Waziri that the duties under the ministry that he has are very massive, Mr. Speaker, because you can live without an education. You can actually live, you can actually borrow some food from a neighbor, but you can never borrow health from a neighbor. You cannot live without good health. Mr. Speaker, I'm just trying to tell the CS that he would do better to work more than he does politics. That has been having been said and done. Mr. Speaker, I want to ask the CS, he has in his response about Linda Mama, he has said that they transited from Linda Mama to Linda Jamii. And one of the benefits that according to the response by the CS, one of the benefits then becomes, Honorable Minister, what is the ministry doing to see to it that there is prevention of teenage pregnancies in order for us to do prevention, because we have always been told that it is better than cure? That's my question, Mr. Speaker. Thank you.
Senator Gataya, more fire.
Honorable Speaker, my question is very simple. What is the fate of thousands of Kenyans who cannot afford to pay SHA for themselves?
Honorable CS, you may now proceed to respond.
Thank you, Mr. Speaker and members. Let me start with the question by Honorable Senator for Uasin-Gishu and the chair of the Health Committee. Yes, the matter was very unique to MTRH. That issue we have resolved, those mothers who had, mainly they had no IDs, and, but we made our own internal contingency, and SHA has paid, and we have told the CEO and the current leadership at MTRH that that should not happen again. The question to my former colleague and senior Senator Boni Khalwale, and Senator Boni Khalwale, I will not take the advice of the Senator for Nandi, because I'm here to answer questions from senators in either form. Senator Boni Khalwale is also a medical doctor. I think the case you have mentioned first must be a very complicated case of delivery for it to reach that level of 600,000. So that was a very complicated case. And SHA covered 60% of the bill. And this must be very clear. Even during the NHIF, there was no full coverage for NHIF. So SHA will cover the bit that is required by law for SHA to pay. There's nowhere where you have to pay 100%. I mean, even myself talking, I have patients. And if the bill is $1 million, SHA pays 700, then the other 300 is an obligation on the part of the family members and relatives of that patient. So, and I think we did our bit. If I go to Linda Mama, first there's no Linda Mama that exists. A transition was done, a more comprehensive, better Linda Mama is now anchored in SHA. And Honorable Speaker, I said it when I was answering the question. And in the answers that I have given to the Honorable Senators, if you look at it, there's a table. And I'll give you an example. Linda Mama, for level 2 and 3, were paying 2,500. For level 4 and 5 and 6, it was paying 5,000. And in fact, there was no equity. They were paying more for faith-based and private, and less for public. The highest they have paid for cesarean was 17,000. Today, under SHA, it's more expanded, more comprehensive. Any delivery that takes place in our country, if you are registered under SHIF, SHA will pay 10,000. From the 2,500 of Linda Mama. So Linda Jamii is paying 10,000. For cesarean, we have moved from 17,000 to 30,000. That is progressive. And it covers comprehensively. For Linda Mama, it was only, Honorable Senators, through the Speaker, it was only for delivery. But for Linda Jamii, it is everything, surgical, anything that that mother and her child will require, even the treatment of post-delivery. Under Linda Jamii is very comprehensive. I have given the data, and you can look at it. 2, it was budgeted, so the budget was not predictive. We inherited 4.2 billion shillings debt of Linda Mama. Today we will not inherit anything. Today we have no bill. Every mother in our country, and about 1.2 million mothers deliver in our country annually. We can give you those who go through SHA. Since SHA inception in October last year, are close to about 690,000. There are many who are delivering maybe at home. There are many who are delivering in private hospitals and paying for themselves. So my senior Honorable Khalwale, this mother could have had a bill of 500K paid, and I'm sure the balance the family will pay. But I think those are rare cases, are very complicated cases. No more delivery, no more cesarean. You are a doctor. You can do better. Again, with Honorable Mandago, let me just read the package, the SHA package, benefit package, that covers normal delivery at 10,000, And this package includes all that you require: medicine, drugs, procedures. This was not found in Linda Mama. It can only be found in Linda Jamii. So Linda Mama has transited to a more comprehensive healthcare delivery system for our mothers. If a mother exceeds 3 days, as he said, the SHA package reverts to a duly bed rebate, which is found in the law that you have passed. So if a mother stays over 3 days, the hospital is to notify through our system, the SHA leadership and officers, and they will do it. Honorable Senate Minority Leader, I agree with you. We have a serious problem in the implementation of the primary health care. Fund. Our level 4 sub-counties, Kenya outpatient, Kenyans, all they need to do is to register as SHA members. They don't need to pay, because it is paid by the exchequer. It's paid by money appropriated by Parliament. But we have incidents in few counties, and you have heard many times the president talking about it, where county Ruto. It has never happened. And this is where, and I think this is where Senate will help me, because the Senate oversights counties. Senate oversight counties. The Senate Health Committee should go and do a report and identify. And we are ready to give you. There are 2 or 3 counties we have found out, and we have told them, and what they're doing is criminal. It's criminal, it's against the law that you have passed. To Honorable Khalwale, I don't know whether it was you. The maternal mortality figures you are giving for Kiambu County is not correct. Yes, it's wrong, and I think it's good you withdraw it. And I am ready to provide. There are many mothers who died, particularly when doctors were on strike. I have the names of the patients, of the mothers, and I have the names of the newborns. I think for record purpose, before the strike, they were doing well. I agree with you. Kiambu was doing well. But as a Minister for Health, I want to confirm to the nation that I agree with the union, with the doctors, that a number of maternal deaths occurred. And I'm ready to provide that evidence. So please, I don't want Governor Wamatangi to hear that and then says I heard it from the Senate. That information is not factual. Senator Nambwere, I think for the first time the anti-D is an injection. I think the doctors like Dr. Khalwale can explain. Is now for the first time is covered under SHA. This is one that helps in the spilling of blood. So this is a more comprehensive now, which is found in the Linda Jamii than the Linda Mama, and the reimbursement for that injection alone by SHA is 6,000. The senator for Nyandarua, Your Excellency, I think he has left. And it's not good, Your Speaker, that you ask a question and then you are not around. When I was, it's not, because you know what was the purpose of asking. But because I'm going on record and the senators are listening to me and the Speaker, let me answer. I think it's good to listen. I've done it. It's okay. That his question was policy, and I want to tell him that policy does not allow definition of any patients, including mothers and newborns, in all our health facilities. And we really want him to report to us any such facilities for appropriate. We want the leaders to report to us. And we have a package. Tariffs are better by 3 times the tariffs provided and benefits provided by President Ruto's government. Is far much better than the one of the old government. And why do I say so? I mean, from 2,500 to 10,000 for normal delivery. 17,000 to 30,000 for cesarean section. That alone tells you, in terms of investment alone, is a big difference. And it's a very comprehensive complementary package. And it does not wait for a budget to be allocated. It is not a victim of supplementary reallocations. It is there. Secondly, the 400,000 teenage mothers in our country are fully covered. They just need to walk to any health center with their birth certificate or with their parents' ID, special ID, a temporary ID for all our teenage mothers. We don't want to encourage that. The Linda Jamii covers the whole family. It doesn't cover only the mother. Linda Mama was covering only the mother. This one is covering the child, even after they leave, so this is a more comprehensive. Linda Jamii now covers Linda Jamii, Mr. Speaker, covers 28,000 per day. This was not present under Linda Mama. And I really want members to get to the package. Linda Jamii now covers anti-D, as the Honorable Senator Nabwere have asked. Linda Mama never used to cover that. I can talk the whole day if you ask me to compare Linda Mama and Linda Jamii. It's world apart. It's like first world, third world, and first world. So I think we must thank. Prevention of teenage mothers, advocacy, we must do a lot of advocacy. A lot of advocacy with our community leaders, with our church leaders. I think it's a responsibility for all of us. We should not promote it, but we have no choice. They are our children, but we must see how we can reduce it. We must ensure our girls enroll in schools and they stay in schools. That is one way we can. We must make sure that school health programs to teach girls and boys about changes of their parental, premarital sex is part of our curriculum. We must have peer-to-peer support for all adolescents. Honorable Speaker, I don't know whether I have left. There was a question by the Senator for Muranga, and Mr. Speaker, I have read the law. I'm coming to the Honorable Senator for Tharaka. Cabinet secretaries by law, we are politicians and we will politic. And I want him to read the Conflict of Interest. I want him to read the Conflict of Interest Act, which was passed, which amended the Leadership Act. Anybody else in the public service cannot do politics. But CSS, the law allows me, and I've tweeted it, and Honorable for Muranga, you have to live with me. I serve a political government, and the law allows me. If you change the law and says ministers should not politic, I will not politic. But for today and going forward, I abide by the law. I'm going to do politics. You know, I agree. He says.
Order, honorable senators. You've already responded to that,
Yes.
honorable.
The last one is on
Conclude.
on the senator for Tharaka Nithi, the great county where our very able and intelligent deputy president comparison. I have a lot of respect for the former deputy president, but I'm just talking about the current deputy president senator. Those Kenyans who cannot pay is a very good question. Before NHIF was a club, the former NHIF, only 1.8 Kenyans in the informal sector have registered. Today I want to report in barely 1 year, because we are about to celebrate 1 year of SHA, over close to 1 million Kenyans in the informal sector have registered SHA. How do they do? There are those who can, they go through the mean testing and they get the amount and they pay. And there are those who can pay. That's why we introduced SHA Lipa Pole Pole. And I want to tell the House, since we introduced SHA Lipa Pole Pole, we have collected over 650 million shillings, where Kenyans go through that, they pay 4 months, the other 8 months, they pay through SHA Lipa Pole Pole, either daily, weekly, monthly. And Kenyans have embraced. As of last night, the figures we got, over 2,000 Kenyans went through the mean testing and paid and through the SHA Lipa Pole Pole. So it's growing. The budget itself and the senators and the speaker are paying more so that the lady in the market, the boda, the people at the lower level of the society can pay less. They can pay 500, they can pay 600 per month, totaling about. There are even those who pay up to 3,600 annually. So, Mr. Speaker, I think I have answered all the questions. Yeah, foreigners, I agree with you. Number one, foreigners have alien cards. Foreigners have different immigration documents. They can use those documents to pay for SHA. The United Nations High Commission for Refugees, have signed an MOU with the SHA, and they have brought their people on board, all the refugees, to join SHA. So alien cards are allowed. They can go walk in and pay cash. They don't need to go through the system. And they can use any of the documents, because they must be using a document to stay in our country. They cannot just be in our country without a document. So the document that they will use can be valid for SHA registration. But the one you have seen, Honorable, my neighbor, Senator through Tana River, is the one that is only meant for the people of Kenya.
Honorable Senators, we shall now move to question number 117 by the Senator for Kisumu County, Senator Professor Tom Ojenda. And Senator Beatrice Akinyi is going to ask that question on behalf of Senator Ojenda. You may proceed, Honorable Senator.
Thank you, Honorable Speaker, once more for granting me the opportunity to ask on behalf of Senator Ojenda, the Senator for Kisumu County, to ask the Cabinet Secretary for Health, one, has the ministry established the exact amount of money lost to fraudulent claims under the Taifa Care Healthcare scheme from the recently concluded forensic review and digital audit by the Ministry of Health? And if so, could the Cabinet Secretary disclose the amount and outline the steps being taken to recover the lost funds? The last question, what steps has the government taken to strengthen financial oversight over the Social Health Authority, SHA, and its associated funds, particularly in respect of procurement and overall financial management. Thank you, Honorable Speaker.
Honorable CS, you may now respond.
Honorable Speaker, a very comprehensive, question one, a very comprehensive forensic review and digital audit was commissioned by the ministry, particularly when I came for the month of, I think, June, July, and August. And this review was executed by the Social Health Authority, the Digital Health Agency that is a custodian of the Digital Superhighway, and the Kenya Medical Practitioners and Dentists Council, together with their colleagues, the Clinical Council, who are the regulators. This review has leveraged on SHA upgraded digital infrastructure, working together with the DHA to identify irregular claims, payments, and anomalies, which were previously undetected within the legacy of the NHIF system. The first one is on financial exposure. Honorable Speaker, the SHA system digital audit that led to the immediate and successful rejection of 10.6 billion in claims that were non-compliant and fraudulent, and preliminary estimates of this financial exposure related to these irregular payments are in the range of several hundred million shillings. A final verified figure will be communicated once the joint audit of the whole SHA system from October last year, when SHA started, up to October this year is complete. This ongoing forensic validation is a proof of the effectiveness of the Social Health Authority new digital architecture in uncovering and preventing fraud. And Mr. Speaker and honorable members, medical fraud globally is about 30%. What are the preventive reforms under SHA that we have introduced? And so far we have rolled out very robust reforms in order to strengthen governance, in order to put in place transparency and accountability. And how are we doing this? First, we have strengthened our AI-powered digital oversight. Our DHA, Digital Health Agency, has upgraded the next generation artificial intelligence and machine learning tools within the SHA claims adjudication platform. This system, Mr. Speaker, detects abnormal claim patterns. It detects inflated bills. It detects duplicate submission in real time. And this is what we call automated pattern recognition. Secondly, we have digital identity verification. The system links each claim to a biometrically verified beneficiaries, ensuring that only legitimate patients and providers are reimbursed, hence safeguarding the public money. Honorable Speaker, if this House is taken through, and I really want you maybe a time to call one of the time when you have a retreat to invite us, and we tell you, and I'll give you a good example. Honorable Speaker, when a child is born, when a delivery takes place in a health center, one of the critical documents that the Social Health Authority will require, apart from the claim form, is called birth notification. It's good, you know, Senator Khalwale listens to me. You know, he's a doctor, and I want him to go and say it at home. Yes. No, the whole of Kakamega County. Honorable Speaker, that document of birth notification is one of the documents that must be provided with a claim for SHA to reimburse that delivery reimbursement of 10,000 or even for 30,000 for cesarean. When you don't submit a birth notification document, whether a child has been born or not, the question lingers. That claim becomes not payable. For example, again, and I'm sure Dr. Khalwale and many doctors in the House will agree with me, if you perform surgery, any procedure, and you want to do a claim, and the claim form is a legal document, and you have not attached theater notes, SHA will not pay you. Because that is not an evidence that even a surgery has taken place within a theater. But more importantly, we have discovered, even against the WHO rules, a facility reporting that all the 300 or 200 deliveries that took place in that health facility were all through C-section. These are the kind of things the system is picking. We have picked where facilities have turned their healthcare workers into patients, where patients have been told, and that's why we stopped the 1 month contribution, where health facilities will go to the market, use their phone to register telephone numbers of the old ladies and the old men, either near the church, near the mosque, or near the market. What have we done to stop that fraud? Now we have geo-fenced all health facilities. No healthcare worker in our country, a doctor, can use his pre-authorization code outside 500 meters of that health facility. You cannot do pre-authorization from the bedroom. And we want to stop where consultants and healthcare workers want to run health facility from the comfort of their bedrooms using their telephone. You cannot manage cases using telephones, Honorable Speaker. The second and most sanctions we have done, we have initiated a very structured recovery and accountability plan, including the immediate suspension of facilities, immediate suspension of doctors and clinicians who are found to have misused their OTP, and we have submitted 1,000, we have closed 1,118 and gazetted in accordance with the law. We have submitted 118 files to the DCI, and I am sure, including some of the staff of SHA, a number have been taken to court, and you might be seeing very, very, very big people going to court either this week or next week. We must fight fraud. The elephant in the room in the delivery of universal health coverage are crooks and fraudsters and thieves. And I want this House to help me, even if when I come back, because we must protect public resources and we must not allow people to eat. We must not allow people to become wealthy by stealing money from sick people. That, I think, we must agree, both as leaders of this country, despite our political affiliation. Mr. Speaker, health is everything. And for some of our colleagues who have really helped me, who say they are listening to the ground. In fact, on SHA, they are listening to the ground. Because Nyeri County is number 2 in SHA registration. That means listening to the ground is very important, particularly when it comes to SHA. Yes, for SHA it is working. I don't know for other things. And Mombasa is number 1 in the country. We must thank the leadership of Mombasa County, because he is at 71% in terms of registration. Muranga is one of the top counties in terms of, and I want to thank Governor Kangata. I think he's focused, he's a very progressive leader, particularly when it comes to health matters. And there are many, many others.
Order.
Order. Mr. Speaker, I have no mandate to give my views on the senator. My paycheck.
Honorable CS, yes. Do not engage the honorable senators directly.
Thank you, Mr. Speaker. I oblige. The second question, Mr. Speaker, was what has the government taken to strengthen the financial oversight over the Social Health Authority? Honorable Chair, Honorable Speaker and members, the government has initiated several comprehensive measures to enhance financial oversight, transparency and accountability within the Social Health Authority and its associated funds passed by this House. The Social Health Insurance Fund, the Primary Health Care Fund, and the Emergency Critical Chronic Illness Fund. How have we secured this? Number one, we have strengthened the governance structure. Today, I'm happy to report that SHA operates under a fully constituted board with an oversight responsibility for financial management, audit, and risk functions. The Audit and Risk Committee monitors and assesses the fund's financial integrity. We have also enhanced the procurement controls. All procurement process within SHA strictly adhere to the public procurement and asset disposal, and we have also complied with the directive of the President and the government on e-procurement system, not only in SHA, but in the whole of the Ministry of Health. It's being implemented, and this is to enhance transparency, ensure competitive bidding, and to minimize human discretion in tender evaluations. We have also done automation and financial system integration. Honorable Speaker and members, SHA has deployed an integrated financial management system that links budgeting, accounting, and reporting functions. And this is to ensure real-time tracking of fund flows and promoting operational efficiency. Second last, we have very clear fund management framework. Each of the three funds under SHA operates under different distinct management frameworks with well-defined allocation criteria, with well-defined reporting mechanism, and with well-defined investment guidelines so that we can prevent the misuse and diversion of funds. Honorable Speaker, finally, we have introduced a very independent audit and monitoring. Routine internal audits are conducted to assess our compliance rate. We and the Office of the Auditor General carries out an annual audit of SHA accounts to promote transparency and accountability in how we utilize this fund. Honorable Speaker, these measures I have said collectively reinforces accountability. They will safeguard public resources, and above all, they will ensure every shilling contributed towards universal health care and appropriated by this House and is paid by the Kenyan citizens is used efficiently, transparently, only for the intended health outcomes. Thank you, Honorable Speaker.
Senator Beatrice Akinyi, do you have any supplementary questions?
Yes, Honorable Speaker, I have. Thank you, CS, and keep going, because the health sector has to work. Aspect of SHA, a proper database of all the health centers and hospitals eligible to SHA must be kept. Now, in your view, Honorable CS, how many health facilities are currently qualified and receiving money from SHA? And would you be willing to share that list with the Senate? 1. 2, Honorable CS, what is the waiting time by the SHA design? And do you think that waiting time, as is in all insurance practices, working for SHA? Thank you.
Senator Cheriot, the Majority Leader.
Mr. Speaker, I want to thank the Minister for finding time and to respond to very important issues. Secondly, I want to appreciate that this is a very intelligent conversation, listening to senators raise issues pertaining to their constituents, particularly on this very topical matter of social health insurance, because it involves people that give us a mandate to come to this House. Mr. Speaker. And it's very enlightening. Mr. Speaker, you know, sometimes I get very disappointed, and unfortunately, some of those people that I see in this house sometimes shout in funerals and rallies that SHA is not working. When the minister is before us now, instead of, you know, it is allowed for a village blogger to say those kind of things, but not for a member of parliament, because you have the opportunity to ask the minister questions like members are doing this morning on issues which the citizens are facing with SHA. I wish some of those colleagues were here this morning. Be that as it may, Mr. Speaker, I want to ask the minister, particularly on Section 42 of this Act. You know, this Act, Mr. Speaker, is very dear to us as Senate. Mr. Minister, you may not be aware, but we passed the social health laws, all the 4 of them, in the sweltering heats of Turkana. 4 days of extreme work, and therefore we understand this law fairly well, and that's why we continue to demand that it must work for our people the way we envisioned. Mr. Speaker, Section 42 of that law, Parliament demanded that at the end of 3 months, actually the wording is within 3 months at the end of a financial year, Parliament is supposed to receive a report from the minister on the operations of Social Health Authority. I want the minister to confirm to the House that in that report that he shall be sending, or perhaps even if possible, Mr. Speaker, he can send a partial report to this House on 3 items that are very important to us as a House. Number 1 is on the spread of county compensation to the health facilities, county by county, so that we are able to know how much in compensation to public health facilities has gone to specific counties, Mr. Speaker. And I explained yesterday on the floor of this House why that is important. And I want that to be sent because I think it was Senator Mogenio who I had him say on the floor yesterday that SHA is not working. So I want to see if there's any compensation that is going to Nyamira County, as well as all the other counties. Why I want this to be published, Mr. Speaker, is so that we are able to know if our citizens are accessing the services that they are being paid for, because those are the people that sent us to this House. And this is something that I have asked the minister, including in our private conversation. The second thing that must feature in that report, Mr. Minister, is the penalties that you have referred to and said that there are members of staff of SHA that are about to be taken to court because of issues of fraud. If there is something that can bring down this very noble initiative, Mr. Speaker, it is fraud. And therefore, it will be important for Parliament to be appraised on how this system has been able to detect fraud, who are the officers that were involved, including the professionals like the doctors and the nurses and the people that you've said aid and abet this crime, Mr. Speaker, so that we are able to read out a list and know that there is a Dr. XYZ who works in Hospital Z in County Y, and this is what they attempted to do, and for that reason, they've been barred and they've been taken to prison, because that is where they belong. Because, Mr. Speaker, we moved the amendments. When this law came to Parliament, in conclusion, Mr. Speaker, I know I've taken long, but let me just make the final remark about it, Mr. Speaker. When this law came before the House, the penalty that had been prescribed, just like all laws that come from the AG's office, was just 1 million shillings. But we moved actually that fine from 1 million to 20 million Kenya shillings, Mr. Speaker, because it was in the best interest of the people of Kenya that anybody who tries to cheat the system is punished by law, so that we can save and help these facilities. Therefore, on that account, Mr. Speaker, I expect that the minister will give us a report of all the fraud that has been detected, the people that have been involved, not just the facilities alone, but the personnel as well that are doing this fraud. The last thing, Mr. Speaker, I am concerned on the rate of rejected claims, particularly in the county that I represent in this House. I was at a public event in a place called Kapkatet a few weeks ago, and the citizens raised concern with me and said, Senator, of all the claims that we have filed, almost 50% are being rejected. What is it that SHA expects of us as a health facility to do? Therefore, Minister, you must tell us as a House, including your officers, to offer subsequent or sufficient training, Mr. Speaker, to health facilities so that they don't provide the service and those claims are rejected. Because at the end of the day, particularly for public health institutions, Mr. Speaker, Service has already been rendered, and we don't want to sink them in debt. I thank you, Mr. Speaker.
Senator Shakil Abdallah.
Thank you, Mr. Speaker. Mr. Speaker, my question is to the ministry. We know since SHA came, there are a lot of challenges, and that is being said, it's working, but my one area which I'm concerned is the lack of clarity on the benefits of the coverage, which is a big confusion to the people at the ground. Because people go to seek services and they are told to pay, sometimes they don't get the services. So I am not sure whether the ministry, I know they did public participation and things, but did the ministry, or is the ministry in the position to do this clarification to the people at the ground to know what level pays for what, so that this confusion can stop? Because this hullabaloo cry of SHA not working, it's because of lack of clarity to the people, like SHA is paying for what, where. That clarity is not there, and this confusion is really because people go for services and they don't get the services due to this confusion. So please, if the minister can tell us, how do they intend to handle this problem, which is really persisting in the ground? Thank you, Mr. Speaker.
Senator Karungo.
Thank you very much, Mr. Speaker. As I ask my question, it's also good for the good CS to note that when we ask questions for the benefit of the House and the public. So whether a senator is here or not here, just like Senator Odinga'S is not in the House and he is answering. So when Senator Medu is not in,
and that's why
we are here listening. Okay, thank you. I just wanted to bring that. Thank you. But in a rare support to the CS from me, Mr. Speaker, I would want to tell Senator Kalwale to stop reading MATIANG'I Times and instead read the Kiambu People Times. Because for the last 150 days, Kiambu people have suffered because of the strike by the doctors, which took the Ministry of Health and the Council of Governors to assist. And now I can tell you the doctors are back to work. And I told the Senate, I have statements, I have even pushed the Committee on Devolution, and nobody acted on that issue when it comes to matters Kiambu. So I thank the CS and his ministry and the Council of Governors. The Kiambu people now are okay. But I have a question to you, Bwana CS, because you have mentioned it twice now, that you're going to release the data or the statistics on matters Kiambu maternal mortality. I think you should publish that and publish for all the counties, Bwana CS, because I believe with that information, you'll help the Senate to oversight, take our oversight mandate well, Bwana CS. And finally, Mr. Speaker, some counties are not using SHA. They're charging cash because probably SHA is not remitting on time. So they refuse to admit them and they charge cash instead. So I would also urge the CS to publish the SHA absorptions per county vis-a-vis the registration. Because you might have the #1 in registration, yet when it comes to absorbing, you're the last. So I think you should also publish that to help the Senate take our oversight mandate. Thank you very much.
Senator Kathuri.
Thank you, Honorable Speaker, for giving this opportunity also to ask a supplementary question. But before I do that, Honorable Speaker, let me really commend the CS and his team. For this time, we are able to understand what is SHA, what is Linda Mama, between Linda Mama and Linda Jamii, Mr. Speaker. For the first time, CS and your team, led by your peers, Dr. Ruga and Mary Mudhoni, and also now the SHA CEO, Masi Mwangangi. Kenyans are able now to know exactly what is happening. And I wish you didn't mention Waziri Nduali. You know, the cause you need the university was not mentioned, but the way you're explaining the SHA and the health systems in Kenya. You are doing better that you are putting across Senator Waziri Nduale. But Nduale, private hospitals and field-based hospitals. Still, there is a problem because of that billion also amount that they are owned. And they are not able nowadays to treat. Most of them, they are demanding cash. We want to move from cash to universal health coverage. So what is your ministry doing to ensure that you are in good books with the private hospitals and the field-based hospitals? Because like where I come from, most of the public hospitals are not functional. But most of the citizens, most of the people from Meru County use the field-based and the private hospitals. So there is a challenge because they are not getting the health care that we need to give them. So Mr. CS, you can give a brief on what is happening and what you're intending to do with those type of hospitals. I thank you.
Senator for Taita Taveta County.
Thank you, Mr. Speaker, for this opportunity to seek for clarification. Firstly, I've had Senator Cheriot speak about hospitals that have not been refunded their claims. And I thought that before treatment, there is pre-authorization. So maybe it seems that like there is treatment before authorization. So I'd like to know which type of maladies or which situations require that there is pre-authorization and which ones don't require pre-authorization. But that was not my point. I'm just riding on Senator Cheriot's question. But my question is about payment for SHA. If I register for SHA and I pay and after 4 months I get sick and I go to a health facility, I'm required to pay upfront for 1 year. Why is it so? And yet I'm up to date. And then you've also talked about Lipa Pole Pole, SHA Lipa Pole Pole. When do I access it? Do I access it immediately I register? So that I go for SHA Lipa Pole Pole so that I pay for the whole year. And if I'm sick after, let's say, 5 months, am I still required to pay for a whole year? I think that is the clarity I would want. And finally, Mr. Speaker, what is the interest rate for this Lipa Pole Pole for SHA? Thank you, Mr. Speaker.
Thank you. Honorable Chute Mohammed.
Thank you very much, Honorable Speaker. Let me first of all take this opportunity to thank the CS for the hard work he's doing. And congratulations, na asante sana, on behalf of the people of Kenya and Marsabit also. Secondly, the issue of employees, former employees of NHIF. Some employees from Marsabit asked me to ask the CS, if they are not going to be absorbed by SHA, the best they can do is go and join other departments in the government. If they join that department, the salary they were earning before and the new place they are going to go to, the difference is huge. Remember, they've borrowed money for their houses before. They've borrowed for their cars. If they go to the smaller salary, they cannot afford to pay those installments. As Minister, what are you going to do to absorb those guys, the employees, former employees of NHIF, under the same employment and salary terms? Thank you.
Senator Mariam.
Thank you, Mr. Speaker, for giving me this opportunity. Mr. Speaker, my question is about the SHA claim, which the majority leader has a detail of it, but let me just frame it differently. Mr. Speaker, the CS explained that they have a digital oversight over their claim that can differentiate between can dictate the normal and abnormal one. Mr. Speaker, when we went to county visit, almost 23 facilities, most of them, they claim of about rejected claim. So why is it that this rejected claim, and if you have this system can detect the normal and abnormal, see, you have to give the counties a leeway that they can do their parts so that at least they can get this rejected claim. Thank you.
Senator Mugo. Rachel.
Thank you, CS, for explaining clearly the operations of SHA and the system in health sector. My question is, how can the ministry guard against governors that are killing the public side of medical practice, that is the hospitals, public hospitals, because they have theirs in town, so that people go to theirs in town and the government side is dead.
Senator Veronica Ndwati.
Yeah. Thank you, Honorable Speaker, and thank you, CS, for what you have explained to the House. We reviewed the answer to get the detail of it, and I'm sure you have dealt with maternal and infant mortality rate, especially because we have been alarmed by what we have seen in Kiambu Hospital. We hope that case is on your desk. Going to the SHA, our phones as leaders have become the backstopping of where patients, when they go to hospitals, the frequently asked questions are actually coming to members of parliament and senators, as opposed to those questions going to SHA. What is the ministry doing to ensure that when patients go to hospitals, seek for emergency treatment in hospitals, they are quickly attended to without requirement for them to pay? And how are you ensuring that anybody who is in an emergency wing of a hospital, public hospital right now, and cannot be attended to because the hospital is insisting that they have not been paid the SHA claims, how are you ensuring they are given support and they are attended to so that they don't have to suffer the consequences of those unnecessary conversations on emergency units when patients need to be treated? Is there any support in that communication and supporting the patient to get access to the health services?
Senator Chiranke.
Thank you, Mr. Speaker. I'm disappointed because most of the senators who were saying SHA is not working, like Senator Omogeni, are not here, including Senator Sifuna, but they are quick to yap in funerals that it's not working. Mine, Waziri Duale, is a very simple question. One, you want to ensure USC succeeds. What can you tell Kenyans that today SHA is working, and in terms of improvement of personnel that work within the value chain or the chain of universal care? Waziri, you and me know that there was a presidential directive, and I know the biggest obstacle has been COG on the issue of confirmation of universal health coverage staff that have been on contract, but I'm happy through your guidance as the CS of health, the SRC has harmonized their pay slips. What is the status in transiting these UHC staff to permanent and pensionable so that we make SHA works? And Waziri, can you use this forum to tell the naysayers and doomsayers, including Senator of Muranga, that SHA is working? Mr. Speaker, I find it painful that many people out there are quick to say SHA is not working, yet they cannot come and ask the gracious CS. And I want to thank CS Waziri Duale because he's the only CS that has always appeared religiously before this House. Unlike other CSs, I don't want to mention names, Mr. Speaker, because I will be accused of playing politics. But I know how to play it somewhere outside there, Mr. Speaker, not in funerals, but in birthday parties. I thank you, Mr. Speaker.
Senator Essie Okanyuri.
Thank you, Mr. Speaker. Whatever I wanted to ask was on the issue of UHC staff, which Senator Cherargei has already highlighted.
Senator Boni Khalwale.
Thank you, Mr. Speaker.
Yes.
I have listened in this House to the Minister and also in the media. When he speaks to SHA, he speaks to two cardinal issues: the success of registration and the challenges in the reimbursements. But in health delivery, the real issue is service. Up to now, St. Mary's Hospital is closed. Colleagues here, they want to play to the gallery to say, you want me to say it's working.
Senator Boni.
Yes.
Senator Boni.
Can you contain him?
Address the chair. Senator Fernandi, allow Senator Boni to make his point. Allow the Honorable Senator to make his point.
Thank you, Mr. Speaker. And therefore, when hospitals served by some of my colleagues and owned by some of them are owed 43 billion shillings by SHA, and NHIF is still claiming 33 billion shillings, how do you expect a clear-minded scientist like myself to say it is working? Anyway, Mr. Speaker, I want, with your indulgence, to allow me to ask the Minister, you have a chance to clarify today. What interest does the chairman of SHA have in the so-called Metro group of companies, in the so-called Metropolitan Hospital and /stroke Labdan Hospital?
Senator Newton.
Thank you, Mr. Speaker. And while I want to commend the ministry for unearthing the fraud that had been perpetrated, costing SHA about 10.6 billion Kenya shillings. Mr. Speaker, the working or otherwise of SHA, like the majority whip has said, will be out there, Mr. Speaker. It is the confession of people who actually benefit or fail to benefit from a SHA that are supposed to tell the story, and not basically what the minister says here. And so, Mr. Speaker, it's important that through you we ask Senator Cherargei, to at least for once, act as a senator and not like that sycophant who only wants to talk about things that are working. Mr. Speaker.
Order, honorable senators. Are we not? Order, honorable senators. Senator Fernandi, Senator Fernandi. Senator Fernandi, order. Now, Senator for Muranga, Senator Jonyut, I will not allow absurdity. Once you take to the floor, ask your question to the honorable senator. Proceed.
Thank you. I'm guided, Mr. Speaker. I only mentioned his name because he mentioned my name.
Just proceed to ask your question.
Okay, Mr. Speaker, there is an organization in this country, and this goes to the CS, Mr. Speaker. May I be heard in silence, Mr. Speaker?
Senator Newton, your statements are drawing these unnecessary
I'm asking my question as guided by you, Honorable Speaker. That's what I'm doing.
Proceed.
Can I be heard in silence, Mr. Speaker? So my question to the CS, Mr. Speaker, is There is an organization in this country, Mr. Speaker, kindly protect me from Senator Cherargei.
Senator Fernandi, what is your point of order?
Mr. Speaker, standing order 101 and 105. Is it in order for the distinguished senator, our Munyoro Adeharan, to accuse me of being a psychophant when I'm doing my legislative and oversight work? Can he either substantiate or withdraw? We are not in a public library somewhere in Kenol. He can go and do his politics here, but not here, Mr. Speaker. I'm a man who has protected my name, Mr. Speaker, and reputation. I cannot be allowed by first-term senators to come and insult me.
Senator Newton.
Thank you, Mr. Speaker. You would think that Senator Cherargei was born a senator and calling others a first-time senator. Yes, I am a first-time senator, Mr. Speaker, and proud to be so. Because Mr. Senator Cherargei was also once a one-time senator.
Senator Newton,
okay, my question.
That is not the point.
My question, Mr. Speaker.
Senator Newton, can you?
I'm asking my question. I'm asking my
question.
Order,
honorable senators.
I'm asking my question, Mr. Speaker.
Senator Newton, you
yes,
will
Mr.
take my
Speaker.
instructions. So be quiet as the chair gives directions. A point of order has just been raised by the Senator Fernandi, that you've gone ahead to call him a sycophant. His point of order is, would you substantiate that statement? If not, then you proceed to withdraw and apologize. And ask your question.
Thank you, Mr. Speaker.
That's point of order that has been raised. You cannot interject.
Mr. Speaker. Mr. Speaker, even as I follow your advice and guidance, and even orders, Mr. Speaker, Senator Cherargei has also referred to me as our Munyoro adherent. Mr. Speaker, probably, to be very fair, do we have such an outfit here in this Senate? And so, Mr. Speaker, I think let it be eye for eye. An eye for an eye, Mr. Speaker. He has referred to me.
Honorable Newton.
Yes, Mr. Speaker.
Honorable Newton, we cannot go down that route where absurdity breeds absurdity. I expected you or any other senator to raise on a point of order. The Senator Fernandi having called you that you're a, what was it again? Wamnyoro? Absolutely. The mere fact that no point of order was raised on that particular assertion. The chair cannot then intervene. But your assertion to the fact that the Senator Fernandi is a sycophant has attracted a point of order. Yours did not. In fact, I did not hear you in any way trying to raise a point of order on that assertion by Senator Fernandi. Nevertheless, the two senators, Senator Fernandi and Senator Newt. Senator Fernandi, you will proceed to withdraw that assertion. Thereafter, the Senator for Muranga will proceed to withdraw the assertion calling you a sycophant. And thereafter, you will proceed to ask the minister your question. Senator Fernandi, proceed to withdraw that particular assertion.
Mr. Speaker, the word...
Withdraw that assertion.
Mr. Speaker, as I withdraw and apologize, the word adherent means you support an idea or party. So it is good that the senator has gone on record that this does not support him. So thank you, Mr. Speaker. I withdraw and apologize. Let the people of Muranga watch.
Senator Newton, proceed to withdraw that assertion.
Thank you, Mr. Speaker, and I'll follow the cue from the experienced senator from Nandi and say that a sycophant is only somebody who says things to please somebody else somewhere. With that, I withdraw and apologize, and Mr. Speaker, now proceed to ask my question to the Honorable CS. Mr. Speaker, I was just bringing to the attention of the CS that there is an organization in this country called RUFA, meaning Rural and Urban Private Hospitals Association. And Mr. Speaker, hospitals under that particular association are not offering services to those covered under SHA. And Mr. Speaker, then my question to the Honorable CS is, exactly what plans are there to see to it? Because these hospitals serve very many Kenyans, Mr. Speaker, and without them recognizing SHA, then many Kenyans have a problem. That was my question, Mr. Speaker. Thank you. And thank you for your Solomonic wisdom and your impartiality. Thank you, Mr. Speaker.
Senator Osotsi.
Thank you, Mr. Speaker. Mr. Speaker, I want to ask my good friend CS a question on the status of NHIF reimbursements, which have been outstanding. If there is any breakdown that he can give this House. Because as we talk about SHA, we should also be alive that there has been long outstanding debts owed to these hospitals by the defunct NHIF.
Honorable Chair, Honorable Speaker, let me start with the first question that Honorable Beatrice Ogola. For record purpose, from the Kenya Medical Practitioners and Dentists Council, Honorable Speaker, that registers all our health facilities. The total number of health facilities registered in our country are 14,876, out of which public facilities are 6,005. Two, on the same, and the leadership and the Council of Governors is coming back to us. And COG is working with SHA to ensure that they update their bank accounts, particularly for the primary health care. And two, still Ogola, SHA has a database with a very active number. Now the ones who are registered under SHA, both public, private, and faith-based, are 10,451 facilities, with each one having a provider portal rights. And payment for these facilities is dependent on the claim review process. Every claim on our dashboard in our system, even when it is rejected, it will give you the reasons why it's rejected. If you have not submitted required documentation, it tells you submit the following documents within 14 days. And different claims are in different stages. Some have just been submitted, some are under review, some have been approved for payment. So it's like a whole ecosystem, and that's why we call our digital system, we call it the digital super highway. When I come to the question raised by the leader of majority, Senator Aaron Cheriot, I agree with you, we will comply. We will comply with the law, and we will, Honorable Speaker, through you, we will give this House any information that is required within the shortest time possible, and I'm sure the members and the chair and the vice chair of the health committee know that whenever I am called, I appear. Just for example, to give you, under the PHC, the primary health care, which is exchequer funded, a very unique thing under this leadership. The problem, people who are opposing SHA are not the patients, are not the health facilities, are people who have a problem with the government of President Ruto. And we have no problem with that. Because today as we speak, Honorable Speaker, over 27 million Kenyans have registered SHA. Mombasa leading, Nyeri number 2, Kirinyaga, Bomet. That's how I can give the list of all the counties. And under PHC, so far, the primary health care, we have given counties 5.6 billion since last October. And we are ready to provide county by county, faith-based facilities who attend to Kenya for this free primary health care. We have given them 745 million. We can give the list one by one. Under SHIF, county governments have so far, depending on how they do their claim, there are some county governments like Mombasa, like Nyeri, like Nakuru. And let me say it, Nakuru PGH is one of the best model that is implementing the social health insurance fund. Since October, Nakuru PGH and Coast General Hospital have received close to $1 billion shilling because they do manage their claims properly. The faith-based organizations have got about 12 billion. MOH, these are the referrals. Kenyatta University, MTRH, Madare, and all these. They have received 6.5 billion. The private facilities are the largest who have received under SHIF, 29.3 billion. This report is ready. We can provide it to the House anytime we are required. The animal or the elephant in the room is rejected, and I want senators to listen to me, Senator Cheriot being. If you see somebody asking you, there are a lot of rejections, he doesn't want to come and face SHA. In SHA, we have relationship managers at the county level, at our headquarters. Our system gives you reason. We have men and women, doctors who do clinical review, who will tell you why your claim is rejected. But because they know those are fraudulent, those are frauds, and we are coming for them, Senator. Tell them we are coming for them. And why are claims rejected? I want to give you 5 reasons why claims are rejected. And once it is rejected, for the information of this House, we are not paying. Claims are rejected because there's no claim form. The law you passed here, the 4 laws, at the bottom of those laws, you have designed a claim form. So a claim form is a legal document. If a facility has not provided a claim form when they are asking for reimbursement, that becomes automatic rejection. If the facility has not given us itemized invoice, that is a rejection. If there are no discharge summaries, God forbid, let me pick on even Senator Cheriot or Senator Khalwale. You go to Nairobi Hospital, you stay there for 2 days, there's no discharge form. And it's deliberate because they want to claim 30 days when that patient has stayed for only 4 or 5 days. So if you don't give us a discharge summary on when the patient has left, that is a rejected claim. If there are no supporting theater, if a patient, a Kenyan citizen, who is a member of SHA, paid up member of SHA, goes to a theater for any type of procedure, and then you make the claim to the Social Health Authority for reimbursement, and you have not attached theater notes, doctors who are in this house will know that. I am not a doctor, but I read, and I learn from people I work with. If there are no theater notes, that's a rejected claim, and we will not pay. If If there are no birth notification, if a delivery has taken place in any of our health facilities in our country, the mandatory document is a birth notification. If you want us to pay for your delivery, whether or normal or cesarean, and a birth notification is missing, we will not pay you. We cannot confirm whether a child has been born, whether a delivery has taken place. It's rejected, Honorable Senator for Kericho. Upcoding. There are people, and this is a medical fraud. There are people, a patient goes for a small boil that takes about 1 hour. The claim they make is that they have done a bigger procedure by even cutting his hand. That is called upcoding, and the system will pick you. We will not pay you. If you convert outpatients into inpatients, that is the biggest fraud. There are Kenyans who go, they are treated, they go home, then the facility turns them into inpatients because they want to claim the bed. They want 5 days. But now, going forward, they cannot do it because now we have introduced the biometric. A Kenyan must go through the biometric when he goes to hospital, and he must go through biometric when he's being discharged. But before the biometrics, they were turning out patients, and we have got evidence of patients who have gone even to the DCI, who are saying, I went for a day. Why is this facility claiming 14 days? Honorable Senate Majority Leader, we will not pay. And please tell these people who tell about rejected, let them go to SHA, they will get all the explanations. As of today, there are people who tell you SHA does not pay. As of today, faith-based, and let me pick, and I want Honorable Kalwale to listen to me. St. Mary has been used for many months for political expediency. It became the talk in funerals and everywhere. I went and sat with the Bishop of St. Mary. I sat with the Bishop of St. Mary, with the whole of my team, including the bank manager. And we have shown our Lordship, the Bishop, that SHA has paid him 90 million shilling. We have given him the TT, the transfer. The balance that at time had was 14 million. We have paid the 14 million. It is you now to go and ask the bishop why he's not opening the facility. And the bishop was with me in a press conference. And I said it, and I said it. Let us not use, St. Mary for politics. And I'm saying it, and I'm sure the people of Kakamega are watching me. Look for something else. St. Mary is a closed chapter. You cannot use St. Mary based. We have the numbers. Before the end of the day, Senator Boni Khalwale, I have sent you on your WhatsApp more than 5 times. You did not respond to me. I gave it to Prime Cabinet Secretary. When nobody could hear, I flew to Kakamega. And I sat with the bishop. And we did reconciliation. We proved to him that we have paid him 90 million. If today I pay in Nairobi Hospital, for example, and the management decides not to run the hospital and close it, that is not a function of the minister. For health. But for my brother Boni Khalwala, number 3, our system is real time. Number 4, St. Mary owes us 8.5 million, and St. Mary owes us 8.5 million, and all these were lodged in the month of October. By the 14th of November, our next payment cycle, if these 8.5 are verified, we will pay. But so far we have paid 114. And please help me. I'm sure this weekend you'll be in Kakamega. I want you to have a different story. to say that St. Mary, Shah has explained, St. Mary, the problem is the management, is the leadership, and I am ready to go with you. I am ready. But Shah is working. Shah is working.
Finish up the questions.
Mr. Speaker, Shah is working, and I have said, you can have a problem with President Ruto's administration, but Shah is working. It is unimaginable every day between 25 to 35,000 Kenyans register voluntarily as members of the Shah Social Health Authority. The train has left. We will implement what many people could not implement because of many side issues. Senator Kathuri, my Deputy Speaker now on the chair, I agree with you. The faith-based settlement rate is at 69.
You know, Senator Mboni, why are you interrupting the CS? You know the CS is not even in the side of the House. That is why you cannot raise a point of order. Maybe after he summarizes his question, you can seek clarification. But not a point of order to the CS. You know it. Please, Boni Kalwale, I told you, let him finish the questions. Actually, he's answering the questions for the U.S. truly. You should be very quiet.
Thank you, Honorable Speaker. Honorable Speaker, your questions, yes. Faith-based hospitals, our settlement rate is 69%. Private hospitals is at 56%. Public hospital settlement is at 55%. And this is delayed because of poor documentation. But the matter that you have raised is very critical. And this is a discussion for the Senate and for the Council of Governors. The people who work in our counties, facilities, own private facilities next door. They own facilities, and I've told governors. So they work at the counties as retention, but they really do their business. And I'll give a good example of Kakamega. The number of patients seen in Kakamega public hospitals and the amount of drugs dispensed does not tally, which means the drugs are being taken to private facilities. And that's why I call upon this great house, which is a custodian of devolution, and which has a Senate Devolution Committee and Senate Health Committee, to go out, because health is devolved, there's very little I can do, and make sure, go see and ask what is happening. We have seen facilities we are closing that are owned by people who work in county governments. So we need to deal with that, Honorable Deputy Speaker, who's on the chair. Honorable Veronica Maina, yes, the emergency cover is active now in level 5 and level 6. We were doing a pilot phase, but I want to assure this House that the emergency cover will be up and running on December 1st to cover all emergency centers in all level 4. Our ambulance services within the ECCIF will be launched in December. And this is one of the beauty about universal health coverage. Never again will a Kenya on an emergency go to a hospital and he will be asked for a deposit. The emergency center we are going to establish will send the nearest ambulance to that Kenya who is in distress in terms of health. It will take him to the hospital. The ambulance is paid by Shah at the rate of 4,500 if it is a long distance in every 25 kilometers. And then when he's delivered to a health facility at any level, that Kenya Kenyan, the first, he lost to Dr. Boni Khalwale. And he wants to use Shah to again for his political engagement in Kakamega County. So he has a choice to make. He has a choice to make. Speaker, let me say it. If If the truth is hurting... Senator Boni Khalwale.
Honorable CS, just a minute. You know, I want to protect the Honorable Senator for Kakamega. Stop referring to him directly. Just make your comments. But without referring to him, I'll give you a chance to seek clarification. I'll give you later. Let him finish.
Chairman, let me finish.
Let him finish. I'll give
Let me
you
finish.
just
So,
cool down.
because the great senator of Muranga has asked me...
Just cool. I will give you that opportunity to raise your concern.
Mr. Speaker, do I have the floor?
Honorable Nikarwale, Senator
Mr. Speaker, what I am
Order,
giving this
Senator
out,
Boni.
I am going on record, is fact, and the Honorable Boni Khalwale should hold his horses. Because Rufa, the leader, the chair of Rufa was his competitor in last election. That is a fact. That is a fact. It's not deniable. Number two, Rufa is an organization. SHA has specific contracts with the over 10,000 facilities. So we don't have any contractual obligation. The Rufa with any organization. And let me in fact say today, for the avoidance of doubt, the faith-based association, the Council of Governors, all of them engage them as organization. But the people who have contractual obligation, who must follow the law, what they have signed, whether in faith-based, whether in private, whether in public, is individual hospitals in our country, because they treat patients individually. There are no patients which are treated by organizations. So we want to get the accountability must be on the person or the facility that has signed a contract. So Rufa, the issue is they do a lot of press conference, they can continue. They can continue. Because Kenya is a free country. On the issue of the debt of NHIF, I agree. The biggest problem we have, and that is even making SHA, the debt of the 30 billion of NHIF has brought down facilities. Some facilities are getting closed. But Mr. Speaker, when I came to the ministry, I set up a very independent committee to verify. Just like the way Edward Awuko, our former Auditor General, is verifying the pending bill of the national government. And he was given a pending bill of 506 billion. He could only verify what we saw in cabinet. I think it's about 206 billion. Some people disappeared. Some did not bring their documents. The same law that tells me I should pay is the same constitution and the PFM Act that tells me and tells us sitting on this side, and subject to your oversight, public funds. Now what I have done is, the people who are owed by NHIF, between 1 shilling to 10 million is about 5.3 billion. Some of them even are owed 300 shillings. And I can provide the list to this house. Now, I have written to the Minister for National Treasury, and that 5.3 billion accounts for 95% of the total debt of these people who owe NHIF. The rest are big people. So I say, let's first pay the 5.3 after we verify. We have now started verifying. I have written to the National Treasury with the blessings of the President after consultation. And by the time the supplementary comes and we have finished verifying, I want to assure the people of Kenya we will pay the 5.3. Secondly, the rest I have also asked a team led by same Auditor General, because his pending bill committee is still alive, with its auditors from SHA MOH to sit down and verify, and we must pay that. Whether it is 10 billion, 15 billion, 20 billion, we must pay, so that our facilities, our people should not lose their investment. There are facilities that are having serious financial challenge. Let me be very honest, because of the old debt. With the SHA, if your bills are verified in this house, they will be absorbed in of our other public institutions at the same salary and package that they were having at NHIF. I have agreed with the court, and we have said, and I have a letter from public service, a letter from to that effect, and I want to tell our staff, the Kenyans, because I agree with you, they had mortgage, they had many things. If they go, for example, to my ministry, or they go to KNH, they will not earn a new salary. They will earn the salary they were earning at NHIF, and they will be placed at the grade, if not better, than where they were at NHIF. I think, so Senator Nyutu, please tell the roofer, I don't deal with, when it comes to money, facilities, the CEO will deal with people who have. Yes, the question about the chairman of SHA. Yes. The chairman of SHA is called Dr. Abdi. And Dr. Kalwale knows. Dr. Abdi does not own any facility, and even before, few months before he became chair. He had a historical ownership. He had a, relax. He had an historical ownership of Ladnan. He had an historical ownership, and in fact, it is Metro that bought Ladnan. And you know the owner of Metro. It's one of our most progressive health facility provider. And I think it's not good. Kenya, you know, it's like there are people who are saying, Aden Duale owns a facility. My assets and liability are within the records of Parliament. I was vetted by Parliament. What I own, if I own a chopper, I own a chopper. If I own camels, I own a camels. And if he owns a facility and you have approved, we will remove him as a chair of SHA. But we will not allow people to smear other Kenyans, because Dr. Abdi is other, to smear other Kenyans, even if it's Dr. Boni or Dr. or Cherargei or Senator Veronica. Because of politics, we will go by the truth. Honorable, my good friend, my leader, of the whip, I want to assure you that he does not own. In fact, the Health Committee of the National Assembly visited London, they visited Metro. They confirmed the ownership is not with Dr. Abdi, a committee of this House. I think, Honorable Speaker, I don't know whether I have left. Oh, UHC. Okay. Oh, yes, UHC. Yes. Yes, let me start with Honorable Shakila, the Secretary General of one of the biggest party.
Stop heckling.
Honorable Shakila asked about our benefits. Our benefits are in the regulations that have been passed by these houses. And the clarity is in the regulations. what is lacking, and Honorable Shakila is saying, is sensitization. We have asked hospitals to put posters in every place in the hospital to show this is the package for oncology, and we will do working together with SHA. We want leaders, all of us, we will keep on sensitizing our people. Even last night, if you...
Senator Shakira, why are you shouting from your seat? Why? No, that is not the way we transact business in the Senate.
So we will do. And then the issue of UHC.
We have no time,
the issue of UHC, Mr. Speaker, and I want to thank Senator Cherargei, just like Senator Khalwale, they represent a wide range of constituency. That is Cherargei, that is constituency. But these Kenyans, close to 7,000 plus, have suffered for too long. They were employed during the COVID. They did good work. They are still doing good work. Part of what we did for the achievement and the attainment of a complete universal health coverage, healthcare workforce is the most important pillar. And that's why we fixed the interns. That's why we dealt with all the health bargaining agreements. That's why you see doctors. Now, UHC, we have the money as a national government. We have the salary, we have the allowances, we have everything. The president has committed in public that the national government will pay. And we have so far put them under the SRC rates. So they earn very good money now. What is remaining is a transition from contract to permanent and pensionable. And because they work in the counties and they are under the public service boards of our counties, I am still engaging with the county governments. But I'm a bit frustrated because they don't see how these Kenyans are suffering. But again, I am ready. The chair of health committee is sitting on the house, Honorable Mandago. You have some powers more than me as a custodian of devolution. You need to call us. The money is available, allowance is available, everything. Ask the governors why they are not transiting these good people to permanent and pensionable. If they were, and if they refuse, I can take them. I can take them to our referral hospitals. We have a huge shortage, so that these Kenyans can have that choice. And Chair, I think that is SHA Lipa Pole Pole has no interest, has no fees, has no levies. It is free. You pay 4 months, the other 8 months, after you go through the mean testing. If the amount is 7,000, you say, do you want to pay the other 8 months daily, weekly, or monthly? Every day, over 2,000 Kenyans go through SHA Lipa Pole Pole. If you don't want to do that, there is nothing we can do. 651 million shillings we have collected since the president announced SHA Lipa Pole Pole in Homa Bay first day of Madaraka. So SHA Lipa Pole Pole is working very much. If you see somebody who doesn't want to do that, then as some senator said here, you can even live with illiteracy, but you cannot live with the sickness. I want to urge Kenyans, universal health care is working. Please let us register en masse for SHA. Let us protect ourselves, our children, and our next of kin. Thank you, Chair.
Thank you. Senator Boni, what is
there was a question from the senator for Kiambu.
Under 1 minute. Just a minute. You will answer with together with
Mr. Speaker. The senator for, let me answer the senator for Kiambu. I agree, and many people agree with me. The maternal and child mortality rate in our country is not very good. It should be a national discussion. I have agreed with the president that we must make it a national discussion. leaders must make it a national discussion. We have about 20 counties that are doing very badly. And we are going to name them. And we are going to shame them. Secondly, we are putting in our digital superhighway as a system where every facility in our country must report maternal or child death on a daily basis. And they must give the reasons. They must give the reasons. And this is real. Our neighbors are doing better than us, all of us. A mother walks to a hospital, she is not a patient. She is very happy. She wants to come out happy with a baby. She is going to a facility to give us another life. We cannot, as a country, it is immoral, it is unacceptable, it's unconstitutional to have the maternal child mortality rate we have in our country. And I think as our leaders, both in all the three arms of government, our religious leaders, we must do something. Our women must do something. But as a Minister for Health, this will be one of the legacy that I have to leave as the Minister of Health.
So we have like 5 minutes. So Dr. Boni Karore, under 1 minute, seek your clarification.
Mr. Speaker, the reason why I was rising to appeal to the minister that this hubris is the demonstration of arrogance of power. You cannot disrespect.
There is no clarification.
Mr. Speaker, this is the House of Debate. You cannot, Dr. Brian Rishenga, find it okay and be unable to speak about Dr. Abdi unless you are in office to launder some people.
No.
Number two, you cannot transfer the responsibility.
You have no mic, Senator Boni Karware. Minority Linda. Minority Linda. Senator Boni Karware, I will kick you out of this house the rest of the day.
But you see, this is what's going on.
No, that is not the way we transact business, and you know.
And now he's here, you think you can...
Senator Boni Karware, Senator Boni Karware.
Managing the National Assembly and the Senate? Really?
Senator Boni.
You think I don't know how government works?
Minority Linda, Progress.
Yes, asante naibu wa spika. Nilikuwa nataka kuuliza lile swali ambalo nilikuwa nimeuliza hapo awali ambalo waziri analijua, na huu mswada wa kwamba waziri yuko hapa hivi sasa umezua mwamko mpya.
Senator Mudigi,
kwamba
allow the CS to get the clarification that the minority leader is seeking.
Katika kaunti ya Kilifi hivi sasa kila mtu anafuata hii debate ambayo inaendelea hapa, na ingekuwa vizuri sana ikiwa bwana Speaker utaniruhusu nimuulize waziri lile swali ambalo nilikuwa nimeuliza hapo awali aweze kulijibu kwa lugha ya Kiswahili. Manake mimi nimeuliza Kiswahili na yeye ni lazima anijibu mimi na lugha ya Kiswahili. Ingekuwa bora zaidi ili watu wangu wapate kuelewa masuala haya ya mamlaka ya afya ya jamii. Sijui kama bwana waziri anaweza kuniruhusu, bwana Speaker unaweza kuniruhusu niulize swali kwa uharaka. Katika
si amekupata
katika masikilizano yale ambayo alikuwa ameyafanya hapo awali huyu waziri, wagonjwa wakienda hospitali, akina mama na watoto na jamii wakiwa wameenda hospitali ile ya level 1, 2 and 3, kumekuwa na tetesi kwa sababu hivi sasa wao wanachajiwa, na hali mkataba uliowekwa na waziri pale ilikuwa ya kwamba watu wakienda level 1, 2 and 3 wapatiwe matibabu alafu waende nyumbani.
Na dakika moja ndio wacha kujibu.
Asante sana bwana waziri, kama unaweza kunijibu itakuwa vyema zaidi.
Waziri, Kiswahili ni ngumu, lakini nataka nisemwambie Mheshimiwa Khalwale, mimi naheshimu sana Ninaheshimu sana bunge. I have a lot of reasons for parliament, and I don't want to go into that. I have no hubris. I have a lot of respectable members of this house. Honorable Chair, Kiswahili ni ngumu, lakini zile vitengo ya mimi ni Mkenya. Mimi si Mswahili, lakini natumia lugha ya Kiswahili. Nitajaribu, lakini isiniletee shida ya kwamba waziri wa afya ameshinda kuongea lugha ya taifa. Ile zahanati ya level 2, level 3 na level 4 zingine ambaye tunaita kwa lugha ya Kimombo primary health care, ambaye inatibu wale wa Kenya wa kukuja na kuondoka, kwa lugha ya Kimombo inaitwa outpatient. Nataka nihakikishe ya kwamba hiyo ni bure na inalipwa na serikali kupitia bajeti ambayo inapita katika bunge la kitaifa. Na mwaka huu ile pesa imewekwa ni bilioni 13. Na hatutakubali, na ni kinyume ya sheria, kama hizo zahanati kama ni ya kibinafsi, zile zinaendeshwa na vikundi vya dini, ama zile zinaendeshwa na serikali zetu za county, kulipisha wa Kenya. Na tukijua wewe unalipisha, basi tutakunyang'anya ile leseni ya bima ya kitaifa ya SHA, kwa sababu SHA ndio inakupatia pesa. Na kiongozi wa wachache katika bunge la Senate, nataka niseme hapa leo ya kwamba ile pesa ushuru ama ile pesa county serikali zetu za ugatuzi wanasanya, ile mnaita kwa lugha ya Kimombo county revenue, on source revenue, kila county pesa nyingi, 65% juu kwa 100 ni kutoka pesa ambayo wanapata kutoka sekta ya afya, na hatuwezi kubali. So Wakenya, nyinyi pia Wakenya wanasikiza, msikubali mkienda dispensary, mkienda health center, mkienda hospitali ya sub county, ile ya kwenda na kurudi nyumbani inaitwa Kimombo outpatient, ni bure. Na msikubali, ile inahitajika uwe umekisajili kwa wanachama ya SHA.
Asante waziri, na asanteni kwa kufika Senate. Tunashukuru na muende salama.
Thank you.
Asante. Honorable Senators, it is now 1 p.m. time to adjourn the Senate. The Senate therefore stands adjourned until later today, Wednesday, 29th October 2025 at 2:30 p.m.